Our Heavenly Father, we recognize that your power is not limited to any generation or to any people. First of all, we want to thank you for past victories. We want to give thanks for the things you've done and for the things you prevented in the past to qualify us to ask for new things. We thank you for deliverance from the Ebola virus and how you spared us as a people, a nation, and a government. And you kept it away from our borders, not because we are better or we're better than our neighbors, but because you chose to show us mercy. For as it is written, I will have mercy on whom I will. For it's not to him that willeth, nor him that runneth, but that God that showeth mercy. Esau have I hated, and Jacob have I loved. That is your discretion, because you are God all by yourself, and you do what pleases you. Once again, we are confronted with another situation, a deadly virus, the coronavirus, taking lives, putting fear in the hearts of the leaders of nations, in families and in communities, cities of the nations of our world. We lift up prayer standing at the seat of power today, from the throne room perspective, from where all authority over heaven and earth and the underworld kingdom proceeds, lifting prayer in that name that is above every other name. For it is written, at the mention of the name of Jesus, every knee shall bow, and every tongue of things visible and invincible in the heavens above the earth and beneath the earth shall acknowledge the lordship of Christ. For we also recognize that at the mention of the name of Jesus, for whosoever shall call upon the name of Jesus shall be delivered. And so we call upon the name of the Lord on the behalf of the government of Ghana. Pray for divine immunity for our government. Praying, Father, for a stubborn determination, courage to withstand these difficult times, that they will have advanced knowledge and wisdom about their years, to skillfully, wisely, and intelligently confront the challenges and the issues that confront this country, its citizens, and the nations of our world. We pray for this government, that in their time, the vicious cycle that has prevailed from one government to another government, the bitterness and the unforgiveness, the retaliations, and all the things that has plagued us as a people and a nation over the years will end with this government. That this government will be the first among others that broke that vicious cycle, and that this situation that confronts all of us, telling us that we are all the same and anybody can die tomorrow irrespective of who you are, may this create in our government the love that is required for country and for one another and for the citizen, the compassion that is so needed in times like this. Thank you, Father. We pray that you will be their guide and their shield, that there will be no loss of any life in government, that no one in government will be a victim of this virus, that no one in government will be a casualty, that you shall preserve, protect, and empower them with the necessary capabilities, that which is required for them to perform their duty for which you have made them a government under the leadership of the President, Nana Addo Dankwa Akufo-Addo. That kingdom come, that will be done. And may we all be here when this deadly virus disappears from the face of the earth, to give thanks and to celebrate your delivering power, your mercies and your goodness that has abound to our government and the people of Ghana. These things we pray and ask for in the name of he who died, rose on the third day, and ascended above all the heavens, even Jesus Christ, the Son of the living God. Amen.
Amen. Hello, good morning, and welcome to Newsfile. This is your most authoritative news analysis platform. 277,169 cases recorded so far. 11,431 people have died. That is the corona chaos. Nations and cities are in complete lockdown. We deal with the facts, the fears, the anxieties, and the stress. How do we stay calm in a state of emergency? The disruptive nature of COVID-19, schools closed, how are parents coping, and how are children and students coping at home. But more importantly, the health minister has announced that at this stage, we should expect the worst, that the disease or the virus will grow at an exponential level in Ghana. We will deal with the facts, the fears, right here on Newsfile. We'll be right back. You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. I'm your host, Samson Ladi Ayenini. Wherever you are this morning, take very good care of yourself. But keep your dials here on Joy 99.7 FM and our affiliates across the country. And also keep watching us on Multi TV. This is your Joy News channel, because we will assist you with sufficient knowledge to empower you, in addition to your prayers, more importantly, to be practical and intentional about protecting yourself and your loved ones. Now, this is what I have by way of my take. Take a look at it.
Sober up. COVID-19 respects no national borders, no social bounds, no political systems, and no cultural values. It hits us just as hard. It levels the world. Facing the pandemic, it is not what happened matters. It is how we respond. For almost a month, it infected thousands in Wuhan in a day, and every hospital bed was occupied. Now, empty beds and closed wards in the city. How did China make it? It is nothing new, but it's worthy to know. According to an initial WHO report, an infected person appears to spread it to an average of 2.6 people. And after 10 generations of transmission, with each taking 5 or 6 days, that one initial case has spawned 3,500 in matters of days. And that is what the world is seeing. What China did is to break the cycle by human intervention. The scale unprecedented in history. Extreme, draconian, and aggressive. These are the words used to describe China's response. But now, people have come to terms with the new norm, lockdown. Some people say, isn't that a violation of individual rights? Actually, the balance between individual rights and public safety is always an ever-changing equation. After 9/11, all the airports in the world began to impose draconian safety checks on passengers, and people accepted it because we traded a little of our freedom for the greater good of the public. China imposed the largest and most draconian quarantine in history. Factories shut, public transport stopped, and people stayed indoors. By doing that, it flattened the curve. On one hand, China avoided many millions of cases and tens of thousands of deaths. On the other, it stretched out the time and make the hospitals restaffed and less strained. This is exactly what Europe and America should know. But public policy needs both ends to agree, the decision makers and the decision takers. Quarantine is indeed extreme and extremely restrictive. It needs the people in lockdown to be honest and cooperative. I think what the people of Wuhan did was exceptional. They had the courage, tenacity, and resilience to stay housebound for days, weeks, and months. Most view the quarantine as a civic duty, and that is why it worked. Public health methods are universal. They either work or they don't. We are all human beings. Our epidemiology is the same, but we have different economies, demographies, and sociologies. Facing a global pandemic, every nation needs a new contract signed between its politicians, businesses, and the public. Desperate times ask desperate measures. This is a desperate time, and we should not put politics ahead of public health, now more than ever. The new coronavirus has been claimed by ideologues. Donald Trump said it justified tighter border control. Bernie Sanders linked it to free health care. While in Singapore, every infection case is followed and dealt with. Bit by bit, every country is testing its methods through trial and error. Some paid a high price, and some set a high bar. We should all move ahead with humility. There is no decision without trade-offs, and most of all, there's nothing without skin in the game. And now, the whole world has learned, or is learning, to play.
And that's by way of my take. The corona chaos, take care. And in Ghana, I hope we don't play any further with it. The NIA, National Identification Authority, is an entity in the office of the president. The president cannot issue directives and measures to protect us, and yet the NIA will act so lawlessly and disregard human life and health. It shouldn't take individuals to sue the NIA and file for contempt against it before it tells us this morning that it has cancelled the clear and present danger that it offered the people of the Eastern region to potentially spread COVID-19. That reckless act must never continue. My guests are in the studio, and before I started, I did announce to you that the world number recorded was 277,100 and something. This minute, it has gone up by 277,203. In Ghana, the number is not what you already know. It has gone up. And as we know, community infections are beginning. That is what the health minister says. We should get ready for the worst. My guest in the studio will help us to navigate Corona and get ourselves ready, well informed with the facts, and deal with our fears and how we navigate the circumstances in the stress, staying calm even in the emergency. In the studio, Dr. Patrick Abuaji is Director General of the Ghana Health Service, and also Dr. Titus Bayo. He was here last week. He's Deputy General Secretary and member of the Infectious Diseases Committee of the Ghana Medical Association. Gentlemen, good morning and welcome to Newsfile.
Good morning.
Right.
Thank you.
So this morning we are big on your situation also, wherever you are, how you assess how Ghana is doing. Let us have your views. How have you been coping with the measures? What have you been doing to prevent coronavirus? Let us know your experiences and how you are managing in the current circumstances. So, to start with, Dr. Patrick Abuadi, Director General of the Ghana Health Service, where do we stand now? Where do we stand now? We got the latest announcement that we have 16, but we know that now we have more than 16, except that we have to go through certain processes and make that official.
Yeah, thank you very much. Yes, currently the number has increased from 16 to 19. And sometimes you don't get the results as quickly as one would expect, because for the service, positive is just one information, but for our response, we need a lot more information. The client will have to be informed about the status, and that takes through going through the facility that refer them and inform them, because that doctor will know how the person is going to take it, so they'll know how to break the news to them. And then we also need to establish contacts immediately. The treatment team, for which Dr. Bayos, one of them, is activated immediately. And when all those things are done, then we can now update the data and to see whether is there an imported case, is it a local case, and that a lot of information that will have to be gathered, especially for the contact tracing team to start.
Okay.
And so it may seem that's probably not coming out as quickly as possible. We need to go through those processes to protect. Even if those who are negative are supposed to know their status. So
all right.
Before, because we don't want a situation where now there are 2 positives and you have 20 people testing for that, then they wonder, is it me, is it the other one? So that is why there's a delay. But currently the number has moved to 19.
Right.
There are about 1 or 2 that we are still a significant number are all imported cases. There are 1 or 2 we are still following up, especially one that we're not too sure whether we cannot identify any contact, but I will follow with the contact tracing to see whether it is a clear case of community spread, which will not be surprising to us.
And more importantly, as you say, we only know of these 3 additions as being tested positive, but we don't know whether they are community infections, and all of this is important, and we need to know all of that.
Yes.
How does that, what does that do to you as those at the forefront of helping the country manage this situation?
Yes, when you have a case that is not imported, I mean, even if it's imported, it is because they are the imported cases that are going to go to the next contract and move to the next contract. But when you start with community spread, then you are looking at the exponential graph that you showed. Right. It means that the risk, especially the way things are going on, that we get worried that this may get out of hand if we don't abide by some of the key interventions for us. And that also means that we need to abide strictly by some of these interventions that have been coming, primarily to reduce contact and grouping, so that we can really cut the transmission from one person to another. So that is where we get worried about.
Thank you. Dr. Bayo, so this latest addition, from the point of 16 to 19, is this something that you, the clinicians, expected, or you actually expected far more?
Well, usually we plan for the worst and then hope for the best. I should say that to the extent that most of our infections are still imported, then the trajectory is expected. But as soon as we are beginning to see more of community spread, then we expect more. So most of us expect that the numbers may actually be more than the 19 we are reporting. And some factors may be that there are people who may still not be showing symptoms yet that we haven't tested. And for very good reason, we are making very judicious use of the testing system. And therefore, not all contacts are tested, and not all people who have returned are tested. So it is possible that the number currently may be far more, but this is what we have. And it is not out of expectation, let me put it that way.
Right.
Yeah.
It's how dangerous is it to think about the fact that in the incubation period, people can infect, and to also think about the fact that within that period, because you do not know that you have, some people actually have not shown symptoms, but have tested positive.
It is extremely dangerous, and I think it explains why the disease has been difficult to control, except with very extreme measures in some countries. And it is dangerous to the extent that, like you mentioned, people may not show any symptom and may actually be spreading. Now, the danger then comes in twofold: to the community and even to the health workers, because some of these people may report to hospital with other conditions and may end up infecting health workers because they have not shown any sign. They may end up infecting people who are very vulnerable because their immune system is low at the health facilities, and therefore that's a danger there. In the community, because these people do not know their own status, the level of social distancing may not be respected as we are advocating for, and that fuels the spread. And it's because of these that in some countries very extreme measures have been taken, like the lockdown, or mass testing, all of which in a particular jurisdiction you have to weigh your options very carefully before you jump to that level. Of course, the mass testing would be a very good one. Yield may be low if we do not select the people well, but it comes at a cost. And if you are having global shortages of testing kits, they have to take critical decisions as to how you go around this testing, so that you don't end up missing the people you really want to test. But those are the extreme measures that can really tell us the actual yield, because it is dangerous when people are shedding without knowing their status.
Right. So what informed your statement as the Ghana Medical Association asking the NIA to stop its processes, even when you say most of what we have experienced so far is imported? That lessens the danger.
So in fact, let me begin by expressing my disappointment with how the NIA has handled this. I'm very, 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 very disappointed, and we in the medical fraternity are very disappointed, to say the least, that it has to take a court action for them to reason along. So the question we are asking ourselves is, should court come out today and then they listen to the actual case and then say that, okay, the people who brought the suit do not have merits? Is the NIA going to continue? Because we gave medical reasons why, public health and safety reasons why the NIA should stop. Simply, we cannot understand why the NIA took the path it took. Be that as it may, we are grateful that by the intervention of the individuals who sued, now they have stopped. Now, what we have been crusading and talking about,
the point is that they have not stopped because you issued a statement. Because when you issued a statement, they called your bluff. Then the SHRAJ, the independent institutional body in this country, also issued a statement on the public health and the right to life that they were endangering people about. What you heard was people saying, let's check when the SHRAJ boss was appointed and which political party it belongs. As if Corona will look at your party, color. Then, what they've actually issued, the statement, they say that the mass registration exercise currently underway in the Eastern region has been suspended effective Saturday 21, 2020, pending the final determination of the application for interlocutory injunction. So what they are saying is that because of the suit, otherwise they would not have stopped. They won't listen to you.
It's exactly my reason why I express my disappointment with their action and their line of thoughts. You know, we didn't come out of this with this statement out of vacuum. As a nation, we really all appreciate, and for us in health, we know the dangers that this condition poses. We know how prepared our health systems are. We don't have to wait to get to that point.
You mean you know how unprepared or how prepared the health systems are?
How prepared we are to handle at various levels.
Okay.
You understand? I mean, for the level at which we are, the health system is doing its best. We know as medical practitioners that if we get to the next level, where we have a mass community outbreak, where we need to test 10,000, 1 million people, our system will be stretched. When we need to isolate over 1,000 people, we cannot cope with it. And so we were issuing that statement as a precautionary measure. So we would not understand why a government agency working under the office of the president would defy it, will not take our advice. SHRAJ will come out, they will not respect it, and go on until the courts come in. And people were asking, is there already evidence of community spread? For heaven's sake, should we wait to see that we have it? Okay, the day after we issue that statement.
Is it not important that they showed you pictures later of the measures that they are taking. So they are saying they are practicing social distancing, and their officers will have sanitizers, they had gloves, and they had face masks.
I rather we don't go that line. The truth is, we know that that is not what was on the ground. We had doctors in the regions. We have a divisional chairperson in that region. We have doctors in all the areas where they were registering. And we contacted people. We made our statement based on very informed decisions. What happens is people mass up, people are assigned numbers, those finally selected for the registration go in, and they are spaced out. So at that pre-trial stage, what happened?
Okay.
That's even in hospitals, we are doing triaging. We are screening people who are coming. We are trying to decongest hospitals. Okay. We are telling people who need to come to hospital that if it is not urgent, don't come. How much more a registration exercise?
I see.
What is the urgency there? You know, so I really wish we didn't go that way. But I just hope that in the midst of all this, some reasoning will come to play, and that at some point they themselves will realize that aside the court suit, the caution that health workers are putting out there is worth its merit.
Okay, right. Now, Dr. Bayo just mentioned that when it gets to a certain point, we may be stretched. Yeah. So our prayer is that we don't get there. Yeah. Question is, what are we doing to avoid getting to a point where we'll be stretched? Because I'm filtering the news in America, in the United Kingdom, Italy, I don't want as an example. Yeah. And I can see how all the best medical systems have been stretched. PPEs are not enough. Hospitals are improvising. We talk about ventilators, and we find out that where we may need to import them from, they don't have enough to give us.
Yeah. Thank you very much. I think that is the point that we started and trying to avoid, and that's why we're looking at early detection and containment. We were not going to kid ourselves in thinking that we can prevent the case from coming in here, because it's global, and with the travel situation, it was quite easy that it's going to come here. But the issue is to look at that. So what our approach has always been limitation of importation. And that's why we started with education, declaration forms at the port, health, to also identify risks, etc. But of course, that was not going to be enough. And so additional measure that the president announced was practically to reduce importation, so that certain categories of people cannot come here, because you can also say a Ghanaian cannot come back to his country, and those who are resident cannot come to your country. We needed to put certain measures like quarantine and self-quarantine to limited. So that's the key thing. The second one is containment of importation. So that even when you have come in, then are we going to quarantine you? How are we going to follow you up? I'm going to make sure that you do not get to mix with people. But the most important aspect is limiting community spread. And that is where we are talking about closure of schools, closure of universities, because you see, you don't wait until you are forced to close. So before it starts, close. Because the way the virus spread has a very high, what we call attack rate, quite high. And so it's very easy to spread very quickly.
Yeah, the experts say that one carrier can infect as many as 4,000 within weeks.
Yes, yes. Because that one is exponential. So I infect two, the two infect two, that becomes 4. Then you start expanding, everybody's infected everybody. So it's quite, so we're trying to ensure that we are limiting community spread by talking about social distancing, sanitation improvement, making sure the markets are done in such a way that people are not
Dr. Bayo said we are prepared to whatever extent that our capacity can. Are we really prepared? We are talking about only 2 laboratories doing the testing. Accra, Noguchi, and KCCR in Kumasi.
Yes, but you see, our response has not just been the status quo. In addition, we are working towards expanding access to laboratory tests. Prior to that, we had only Noguchi. KCCR came on board. We expect that within a week or two, we have at least 2 additional centers that will be doing testing.
We're expecting 2 additional centers. Where?
We're looking at Tamale and Ho. there's a lot of work going on to ensure that they are also able to test.
So that we are likely to have 4 in total.
Yes, and so
and you're saying you expect this to come on when?
Within a week or two, it should be able to.
Within a week or two?
Yes. Under the
That's the period it takes for one person to infect as many as 4,000.
Yes, but that is if your containment methods are just loose. And as long as people go, I mean, you say companies should allow people to work from home. If you don't need to go to the bank, don't go. And these are the things that we need to carry the people with us.
Containment method you speak about, the WHO says this point, they started with containment. Now they say test, test, test. Yes. You have only 2 centers. You are seeking to increase that to 4. That is woefully inadequate. And that will come on board in 2 weeks. Within the 2 weeks, if you have 1 carrier, they could infect as many as 4,000.
But let me also tell you that even the capacity at Noguchi is high enough to do over 1,000 tests a day.
Okay.
Okay. It's about moving the samples to the place. And like Dr. Beyo said, these are testing policies that you need to ensure that can you afford it? Is it something that you can look at? So those are all the actions that we, but I'm sure we are ready to expand and treat more. The epicenter has basically been more in Accra, and now we have about 3 cases from Ashanti region and Accra. So those are areas where we...
Of course, the 3 new ones, we don't know where they are from. We only know that they are positive. They're also from Accra?
No. They are, okay. And for the last 3 new cases are actually imported cases.
They are also imported? Yes. You have confirmed that?
Oh, yes. But in between, those in the there's still 1 or 2, we're still trying to identify the contact, whether it's a contact of somebody who imported and probably come and gone or something. So those are the things we're looking at. But we need to ensure that everybody played their role. This is what you saw in China. The people came to the table, they were there, they abided, they were not all the rules. But now you see town, everybody is in town, people are not, the groupings are taking place. Those are places that we need to ensure that people become more cautious and apply the social distances. Now the local government is trying to get into the market to ensure that it can bring some sanity, etc. So that still to reduce the possibility of a spread, and that's a very important stage. And I'm happy we have started early enough. And if everybody comes to the table, because if people don't abide by this and don't see the risk and also participate, it becomes very difficult for me, Dr. Bayo, or anybody, or you,
right.
to tell people.
So I was looking at elsewhere where we would always fall on and depend on who are now, overstretched. They are building new facilities or make up temporary places around the hospitals to, accommodate more people by way of quarantine, and so on and so forth. When we talk about the PPEs, all the equipment that you need, what exactly are we talking about? Can you take us to the basics? What are the things we are looking at?
We are looking at things like gloves, masks of different types, depending on who is wearing it and what you're using it for, and identify the surgical mask. We're also looking at the coveralls, aprons, and so and you also have the caps, etc. So there's a whole regalia. I mean, the full regalia is the person who is going to treat an affected person.
Okay, so this is intended to give protection, an assurance of protection to the health workers.
And the people. Because when a health worker closes work, he's just like one of us. And so that's still part of the process. And those are the things that we need to do. We are looking at the pre-triaging where you select people who are likely to be the first.
We understood we had a certain initial quantity and we were looking for extra. We had asked for extra. What are we talking about?
Before the incident occurred, we had reserves from that were not used during the Ebola time. Okay. We quickly brought in 5,000. We brought in 3,000. We had other donations coming in. But the government is ordering a few more. Like you are aware, because of the global crunch, and a lot of the PPEs are produced in China. We have to, but we know that China has started production, and so additional ones will be brought in quickly. There are a couple of companies that have, but you don't have somebody who has 50,000 PPAs.
So what are we looking at? Because the people that where we are going for are the hardest hit, well, they are recovering. So what's the time estimation we're looking at? How long will it take to get the next consignment to us?
Like I said, there are organizations, lucky enough, there are individual Ghanaians and organizations who have actually brought them in. And these are the ones we are mopping up to bring it in whilst we wait for the bigger box. So there's a lot of organizations, and Dr. Barry knows, who have approached us. We have this number, we have that number. But of course, we are competing in the sub-region. Nigeria is looking for some, Benin is looking for some, Togo is looking for some. So those are the ones we are quickly mopping up whilst the bulk will come in.
So is it automatic? Is it certain that the sort of COVID-19 curve that you have become familiar with, any country that is affected must necessarily do the curve before they come to a recovery? And what will that mean to us? I've been following and watching, for example, Iran. Within how many days, how many have been affected? Well, Italy is not a good example, but in 10 hours, and you have 600 deaths. That's not an example you want to look at.
No. So the best would be to avoid this, to flatten the curve very quickly, let me put it that way. And that is why a lot of our effort should be at the initial stages.
Explain the curve and the process to flatten it.
So the whole curve is that for such an epidemic, it starts, it exponentially goes very high, and then by that time the system gets awake, very drastic measures are taken, and then there's break in the transmission. And once that break in the transmission is achieved by whatever means, then you begin to get the numbers coming down, because the disease runs a natural course. And so most of those infected will either recover, or those who may unfortunately die will die. And then the burden of the disease goes down. So once there's no new infection, we expect a normal drop. Now, for us, how can we prevent that exponential rise? Because that is where our issue is. There are different levels of this battle. And if you look at the clinical disease, it's graded as mild, moderate, critical, severe, and critical. Our greatest worry from the point of clinicians is that we do not think our level of preparation when it comes to severe and critical is up there. Because in the well-established systems, they are struggling at that level. And that is where deaths occur. So we are trying to prevent as many people from getting to that severe and critical stage. So how do we do that? And I think at this level, there are just about two things. First is the test.
Right.
So we identify, because you see, we are trying to carry the population along. How do people get along if they don't know their status? So if I want to make sure that I don't infect other people, I must first know that I'm infected so that I don't infect other people. Then the other means is the public education, that is obeying the social distancing and all, because that is what will also prevent the spread. So that people who are not even certain, if we all obey the rules, then we are able to present. But I think the testing, so if you remember in our release, we asked that all regional hospitals should be given the capacity to test. And we should add the public health reference lab and other labs to be able to test, so that the testing is closer to the people. The other thing is an efficient call system, because I see this from two main perspectives: managing the health workers and managing the population. If you ask me to self-isolate and you give me contact lines and I call those lines and they are not going through, I call and no one is responding, I call and I'm unable to reach anybody, at the least sign or symptom, the first thing, the person will panic and will jump out into the public and will rush into the hospital. If you go to other countries, what they have done is that they have decided that don't come into a hospital, call. Because you see, if you are a suspected case and you even walk into a hospital, touch wood, if you are really a case, by the time you make a folder, go through the system, you would have infected other people. So if you have a very efficient call system, it is something that I still do not understand to date, why we still have the very long numbers. I have made this personally known at various levels that by this time, we should have that unique code which is very efficient, backed by a very sophisticated IT system that almost everybody calls and gets through. But if you are still using these long numbers, you have to give a number that's 10 digits, people have to try and memorize, and even when they call, it's not going through. It makes that community mobilization bit difficult.
All right.
And then the testing. As for the testing, currently, I'm privy to the difficulties we have as a nation. And so we cannot do mass testing for anybody at all. That, I think we all must agree with the system, because till such a time that we think we have enough testing kits to do that mass testing, then we look at the epidemiology of it.
You're saying that if we had enough testing kits,
yes,
we could have started mass testing now.
If you have enough testing kits and testing centers. Because the mass testing has been shown to be effective.
That's why the WHO says test.
But you have to localize it to your country.
Okay.
How much do I have? What capacity do I have? What is the burden in my country now? And how do I apply it? Because I bet you, if we open up the floodgates and say, anybody who feels like testing, get tested, perhaps in a week, maybe we'll run out of the kits. And then what happens? You get it.
As I follow the news and I hear about the need for ventilators, among other things, what is the role of ventilators in the process to help this situation?
Okay, so the ventilators are in that last stage, the severe to critical phase, which I said we wish that as a country, we doctors, nurses, everybody wish that we don't get there. Where we have a lot of people who are sick, who are in severe or critical stage, who cannot breathe on their own and need to be put on a machine.
And that's what the disease does?
Yes, that's what the disease does.
Gives you the problem to breathe?
The breathe.
Okay.
To breathe. And this happens so far from the epidemiology we are seeing to people who have underlying health conditions, very old people, or people who are severely affected. They get to a point where they are not able to breathe on their own. Now they need a ventilator to breathe for them.
All right.
Now, at that stage, honestly, I don't think our system is well prepared for that yet.
That's the stage where the clinicians or the physicians were told make a decision on their own, who to help and who not to help. The information we have is that the whole of this country, we have about only 50 that are functioning. That's woefully inadequate, correct?
I don't have the exact figure, so I will not want to put out a figure, but definitely it's inadequate. I can tell you that if you go to a major hospital like
we need them in the hundreds.
Exactly. I'm telling you that in the stage of outbreak in Italy, there was a pre-lace 601 ventilators there, and they were all in use. And the Italian Medical Association and practitioners had to make critical decisions like what you are saying, a sort of a triaging. Who do we put on? Who do we take off? And that is a decision no doctor wants to make, because essentially it means you are telling someone you are good enough to die, while this person should be given a chance on the ventilator. And to the extent that we don't have enough of them in the country, we will struggle to even get them to purchase when we want to even purchase. It means we should start having our systems in place to prevent us from getting to that level.
Okay.
That's severe to critical. But what we have now should also be efficiently managed. And it's not only the ventilators, because the ventilator is a specialized machine. You need a critical manpower to man those machines. So even if you buy 200 of them and distribute them across the country in a district hospital, and there is no anesthesiologist, the normal health workers there cannot put a patient on this ventilator.
Okay.
And they cannot monitor the patient. They cannot do the settings to make sure the patient is safe on it. That is where the challenge comes in. So I think that our best bet is to try and make sure we don't get to that level.
All right.
That the numbers reaching that level are low. Whilst we are at that, the managers of the system, like Dr. Abuaji and his team, have to look at how do we efficiently distribute the few we have in the system.
Okay, and there's a Ghanaian doctor, Samuel Kojo Amwakuhene. He's an anesthesiologist at Connecticut, and he has an idea and has been demonstrating how you can use one ventilator to take care of multiple people at about 4. But the doc, what are your expectations at recorded cases of 16? We said we had as many as 600 contacts that we're tracing. At 19, what is the expectation?
Well, the expectation that it will be higher, And currently we are, for the first 16, we are doing about 590 something contacts. We've covered, based on some of the cases, we covered contacts about 100%. There are some we are doing about 98%.
Okay.
And they are all, fully covered. The additional ones depends on how long the person is and how cooperative we are able to look at it. We are using actually the SOMA software to actually follow them up and see how we can see how many we have seen. But also, Tito just made some few things about the calls. For the past 1 week, we moved to 112. And so that is available through the Ministry of Communications, which we are using. Like I said, these things just comes at you, and so you run after that, and then we look at that. But our people too must be also be helpful. If someone decides, let me test the number and see if it works, then you jam the number. And so if everybody testing to see if the number really works, then the person who really need the number, and that's what was going. We looked at about 150 calls. Number 120 of them, they just asked whether we wanted to check whether the number is working. And so these are all practices that we must stop. But we are doing the contact tracing. As the more comes, it's exponential. On the issue of testing...
Can you explain that to our listeners and viewers? When, at this point, the minister says what should be expected is exponential, rates at infection, what does that mean?
Well, that what it means is that because the people are already coming with cases, they have made contacts have made contacts. We are looking at it. But the good news is that of the contacts, we've tested a couple, and so far none of them have turned to be positive for now. And so one expects that with exponential growth, there's likelihood that there's somebody who may have picked it. There's somebody who may have come in without symptoms and also come for testing, and so that person may be under the radar.
Okay.
So those are the expectations that we don't want to take chances on, and that's why we are also brought in this issues of that reduces contact as much as possible to preempt any or reduce the possibility of spread. But the contact tracing, what we are doing as well is that for those who are sitting in the flight, because we have the manifest, we have a pushed text message now who will tend maybe all of you on the same flight in KLM, you get a message so that you can also come around.
You may not be in a position to take these sort of decisions, but would be advising certainly. For example, California, elsewhere, have taken a decision. So far, about 3 states in the US, as we know, I think the number may have increased by now, have decided a complete shutdown, stay home policy. At what point should that be within our contemplation, particularly given the speed at which the disease spreads? When we started the show, the global recorded total was 277,000 plus. As we speak, it's now 278,534. The deaths now at 11,554. Of course, there's also the part that I like to talk about, which is the good news, that 92,906 have recovered. In Ghana, we had a story of one of those people yesterday who was tested and now, is doing well and is excited about what is happening. When do we get to the extreme measure of a shutdown?
Well, if I want to apply public health principles, that will be now. Well, we don't live only in public health systems only. We have other parameters to consider.
You're saying if you were to advise, you say now, shut down.
Yes, looking at just only the public health principles alone, it will be now. That will be the best. But there are other ramifications. And so those are those things that the powers that be will need to calculate and make sure that at the earliest point, such systems are put in place. But for me, even the kind of introductions things that have come in now, if we are disciplined enough to abide by them, it will significantly work well. The fact that they say we are closed schools doesn't mean that go and meet in the park and play football because you have time. We need to ensure that we stay home. We ensure that we don't go out. If you don't really have to go out, you don't go out to the mall just roaming to see what's going on. These are the things that all of us.
In fact, if you have to be in a gathering, you must be not more than 25. Unless you are the NIA, you must be not less than 25.
I don't know where that 25 is coming from.
That's the president's.
No, that's for funeral, private burial.
Oh, I see.
So that's for private burials. I don't know.
Only for burials.
Yes.
Okay. How about weddings?
They're all banned now. All gatherings are banned. I think
really?
the weddings, what the Accra Metropolitan Assembly came out officially was that you are perhaps allowed, just you, the couple, 2 witnesses from your family, 2 witnesses from the other family, 6 people. But the 25 is for private burial. And I think people have interpreted
looking at our social context.
that it's difficult to say people should not bury.
All right.
And I mean, there are ramifications on that,
Yes.
you know, because mortuaries are getting full. If you say no one should bury, where do we keep them?
Yes.
So just the burial is what is allowed for that one, you know. So I think.
So I mean that will be the thing, but I'm sure other measures will probably kick in to ensure that we have reduced importation, reduce contain importation, we limit the spread, and most importantly, care for the sick. We currently have centers across the region where treatment can take place. We are not going to do grouping into specific centers. We are spreading everywhere so that Kolebu should be able to manage their cases, Rich should be able to manage their cases, and other places, so that we don't really have this. But we are working very hard. We are looking at the resources that we are being privy to now. The essence is not just to fight only, but also prepare for the next outbreak. And that is why issues of ventilators and this are being procured to beef up the system.
Samson, I just want to just
Okay, so Doc, all of you have said, and particularly you, because of the special position you and role you play, you had said that you're expecting other details before the 3 new ones would be updated on the website. So on the website now, it's been updated. That's the Ghana Health Service.org website. It's been updated. So if you like, once again, to be double sure, it's 19. It's 19. I'm looking to get the details of the new infections and what exactly they represent. I'll look for them, and then perhaps we will find out. But you had confirmed earlier that they are all imported too, right? Okay, you are about to make a point.
I was going to say that the health system is working hard. Our public health colleagues are putting in their very best. I think we need to commend that and commend what government is doing. However, there are a few things I think that needs to be improved, and I think we need to look at communication and communication and communication. And the communication in twofold: communication to the general public, communication that inspires confidence, that lets people know that we are doing our best at this, and carry the people along. And more importantly for me, from where I'm coming from, is communication to the health workers. And I think we should have these 2 communication channels very, very well outlined. The people at the front line of this work must know more detailed information than what is given to the public, and that should guide them in decision making and all of that. For instance, I have been privy to the detailed work that is being done as far as contact tracing is concerned. And when I got the details, I got so confident, and I was like, this system is working. But how many people know this? And I think that especially for us who are the front line should know, because I, for instance, know yesterday how many people were called on phone, how many people they went to visit. If you take the Legon one, for instance, they went to the halls of residents to meet the people who are supposed to be exposed. This type of information should come up to inspire us confidence in the system that people are working. We know, we've heard in the media that there's some form of insurance policy for frontline health workers. The people directly involved don't know what is in it. So is it life insurance? Is it insurance that covers critical illness? So if a nurse caring for somebody with COVID-19 gets infected, what does the person get? Is it only when he or she passes on that something is going to be given to their family? What some of this information will come out and then will inspire people,
I think,
to go on.
Dr.
So
Wadi, are you in a
he's
position to explain what he's talking about the insurance, what exactly it covers?
We have two types of insurance, and we are working with the associations like GMA, GRNA in determining the package. First is the insurance, life insurance, for which we have done for a number and anticipation. We hope we never ever get even 1% of that. And then also the second level is, I would say, injury, mobility, etc. Those are also there. And there are also some little incentives for the frontline people who are looking at some of these things. You need to build consensus with, with the associations before you put it out there. As to whether they accept, and he knows that it is there.
Let me give you details about the 3 new cases, and then we'll take a quick break. When we return, I'd like particularly Dr. Boakye to try and give us an answer, if he has, about questions that people are asking, because at Kolebu, as we understand, there's a construction that has begun for the purposes of COVID-19. Questions people are asking. We have magnificent, well-equipped facilities that have been built and are not used or underutilized. Why are we not using those facilities rather than seeking to build new ones? Questions Ghanaians are asking. Of course, it's their tax that is used for these purposes. So the 3 new ones, number 1, is a 55-year-old Ghanaian woman, resident of the United Kingdom, returned to Ghana within 2 weeks. Sample confirmed positive in the laboratory. Number 2, 84-year-old Ghanaian lady, resident of the United Kingdom, came back to Ghana within the past 2 weeks, developed symptoms, and sample confirmed positive in the laboratory. And the third one is a 27-year-old Chinese male, returned to Ghana in the Ashanti region in the past 2 weeks, developed symptoms, and sample confirmed positive in the laboratory. And the update now says this brings to a total of 19 confirmed cases in Ghana with no deaths. Contact tracing has started in all these cases. Dr. Bayo actually correctly said, as you follow experts across the world who say the numbers reported do not represent the exact numbers. We'll get him to explain what he means by that and what the risk in that is, particularly as we have discovered 3 community infections so far. We'll be right back. You're welcome back. This is Newsfile. It's your most authoritative news analysis platform, and we are discussing COVID-19 rising in Ghana, facts, fears, and stress, staying calm in emergency. So as you know now, if you have any suspicious situation or for yourself or for some other person, the contact is the emergency line 112. 112. The advice is that you call and you don't just wake up and walk into a health facility. Correct, Dr. Wadi? Yeah. Great. Okay, so my guests who have been helping us to understand what is going on in Ghana's preparations, Dr. Patrick Abuaji, he's Director General, Ghana Health Service, and Dr. Titus Bayo is Deputy General Secretary and member Infectious Disease Committee of the Ghana Medical Association. Dr. Abuaji will take a couple of questions and then he will leave because he has a very important assignment to attend to, having to do with this same situation. So a number of questions have come up, and first wanted to know why put up a new project at Kolebu where there are so many of them that we know were built and are ready for use.
Okay, thank you very much. We are not building isolation centers for COVID. We are decentralizing the services so that every hospital should be able to have a place where they can manage them. And that is why Kolebu has a fevers unit, and I'm sure that's what they are trying to refurbish to be able to use it, so that within the facility, we don't want a situation where it's like a different outlandish area where you are managing them. We may eventually build some infectious disease centers standalone, but that is for a larger group. But for this COVID, we are looking at everybody, whether you are in Bolga, Wa, everywhere, you should have a space where you can.
And this mostly would take the shape and form of, tents. No
tents. No tents. Like I said, we are preparing for the next outbreak. This is not going to be the last one. So we need to put systems in place, sustainable systems that allows us to respond better.
And we're expecting these projects to be done within what period?
You see, funny enough, we have a lot of centers that needed a lot of touch-up. Certain wings and wards and hospitals that could be quickly done in such a way that they can be done there. Some of the cases are being managed at home. So it's really not all of them that will require even hospital care. And that's why we want to build systems across the country.
We know how things happen in this country, Doc. Look, we are watching elsewhere and the system is overwhelmed.
We understand.
Are we setting that we can do these things within time rather than adopt the measures that you find elsewhere? They are using temporary places around the hospitals.
No, we can use temporary places around the hospitals, etc. But we are saying that all hospitals must have a place where they can manage.
Okay.
And we know there are many places that are available that can be used. There's a 13-bed place in Kumasi South. There's another place that can take about 30 in Kintampo and Techiman. And those are all the areas that we need to. We don't want to be carrying everybody into one center.
There's a question about requiring you to tell us, if you can, exactly what support has gone to Noguchi and KCCR to help them do this thing, because they are the only two.
Well, I will not be able to give you, I wouldn't want to give you figures here. While we know that there's allocation, not only for them to work as it is, but also to scale up our laboratory system for this thing. So those allocations have been made. And
the 8 people we're told are recovering. What can we say about their state?
I don't know where, I've seen that elaborate website, I don't know where that is coming from. We see, when you have a case, even the very first case has not gone through the 14 days. What we do is that when about 3, 4 days to 7 days, when your clinical signs are over, we do a test. If it is negative, then you're out of the woods. If you test and we tested one, it's still positive, we'll keep at a few more days. And so currently we have not certified anybody as recovered. All of them are stable, very mild conditions. Some of them are even being managed at home. Over 6 or so of them are only ones that are on admission. The rest are at home. And so we have not, there's a certain protocol that you need to go to certify that you are home, you are free, you are
okay. So we'll respect the contract. You have to leave now. But a last question from Nana Hesse Ojiri. He says that clearly 80 to 90% of the cases are imported ones, i.e. horizontal cases. And if analyzed, these affected ones entered the country before the president's first nation broadcast. That is 2 weeks before. The question is, how many of such came into the country? This is no longer funny. So, are we thinking about it this way?
Yes, and that's why we started very early with the declaration form to assess risk. And remember that a lot of people were detained at the port and screened. Some of them were taken to facility to test. So those clearly who came with sick and who had significant risk were followed up by phone calls.
Some of them are complaining. We are told of the students at Legon. They are saying that, look, we even food, they are complaining. They are complaining. They feel they could break out and leave.
We will look at that.
You will look at that? Yeah. Okay.
Thank you very much.
Thank you very much indeed. Dr. Patrick Abuaje is Director General of the Ghana Health Service, and we all have to pray and support our health service workers, the clinicians, and all the people involved, because these are not normal times, and they are coming face to face with these cases. You want to say something?
Last word. I think we must agree that this is a health condition that requires a multi-sector response. And that's exactly what is being done.
Okay.
And we want everybody from the media, transport, everybody to be part of this response.
All right.
Otherwise, we'll...
Thank you. Thank you very much, Dr. Patrick Abuaji. Dr. Titus Bayo is still with me here, and we would shortly also bring in a next panel to assist us to continue to discuss. But we want your questions to come in. Tell us how you are coping with the shutdown as far as schools are concerned. West African Examinations Council, examinations have also been postponed. This is how this is affecting. We know that people are losing their jobs elsewhere. In anticipation, in the U.S. alone, some close to over 3 million are expected to lose their jobs and to file for unemployment. There are stimulus packages that are being introduced all over the place. How will this affect Ghana's economy? Now, Doc, as we're talking about Noguchi and KCCR and how they could be supported. What do you think? You are asking for a lot more transparency to give us confidence as citizens. Yeah. How do you expect the government to go about this?
Yeah, so in terms of the support for those two institutions, they are critical at this point. And I think last week I made that same point here. We are expecting them to work 24 hours to handle all our samples for us. I think that support is fundamental, because without the testing, we don't know what we are doing. And we'll be working in the dark. So that is fundamental. But I also think that at this point, the testing capacity of the country must increase. And we cannot overemphasize that point. We know that there are mobile technologies that can be deployed where this PCR testing that is being done at these facilities, there are mobile technologies that can be deployed with supervision from these same centers, so that these tests can be conducted at least in all the regional hospitals, so that people who feel they have symptoms, they meet our case definition, or their close contact can be tested. Because it's the only way we can help contain this disease.
When you talk about mobile technologies, are you referring to what one of our viewers, listeners, was asking? He said, are there plans to order the rapid testing kits for citizens to test at will?
No, the rapid...
That's different.
No, it's different. The rapid testing kit, it uses antigen antibody, and it is not as sensitive as the PCR. The PCR is the high-level testing. That is what is recommended for testing and diagnosing everywhere. The rapid antigen will have a role to play. It's just that it can be like a screening tool, because some people will test positive to that who may still eventually be negative. And so if you are using that, then there must be a second level, and that then has to be deployed across the country. People can test themselves, and then those who pick up positive need to go for confirmatory test, which is this PCR. But the PCR is a gold standard for now. And if that is deployed there are mobile technologies for this PCR testing. And that's the one I was referring to, where KCCR, Noguchi, if well resourced, can deploy these mobile technologies for the PCR, supervise it, spread out their staff to help handle this testing at regional hospitals, at our public health reference laboratory. If that is done, then the testing is expanded. Then we can pick up as many people as possible. And then we'll be able to contain the situation. Interesting.
People have been asking a couple of questions about this thing about self-isolation, self-quarantine, the question about also social distancing, which is the most effective, one of the most effective ways to, prevent the spread. They say when you talk that way and the emphasis is like that, you are thinking as though Ghana is the little plush Accra, because you don't seem to look clearly at the homes we are talking about. Compound houses, where you have dozens living together, and they may share, if there's a running tap, one perhaps, and all sorts of things. How difficult are things going to be if the numbers do rise exponentially as you expect?
So, in our context, self-isolation will be very difficult, especially for people who live in those setups that you have described, because then it's very, very difficult. If you are sharing, you have a single room, and I put this up on one platform, that if you have a single room where you have a husband, a wife, and maybe 4 kids in there, and you say self-isolate, so who leaves the room and who stays in? These are practical challenges. And that is why, as a state, we must get to a point where people who cannot self-isolate can report to a system that can help them isolate. And that requires a lot of investment. So that if you think that you are exposed, and if you return home, you cannot distance yourself from your family because you all live in just one space, the state should be able to have a system where you can voluntarily go in and then be isolated and cared for there. But to the extent that we do not have such settings, it is difficult. Because if you put it in our context, not everybody can have a room where they can go in and no one will contact them, no one will be with them within, because they perhaps sleep in the same room. Poor ventilation. In some parts of Accra, someone's window opens into another person's house. So what kind of isolation can occur in that setting? Okay. But I think that for the public gatherings, we all must respect what has been put out by His Excellency the President, and the efforts that we are putting in as a nation, that we should respect this social distancing. And I think more radical measures should be coming up by now. Our public transportation systems. We are sitting in churches where people are still packed together.
That's a very fertile place of spread.
Exactly.
Right?
Once we are confirming community spread, we must have changes there. And that itself will also serve as a deterrent.
The transport owners and drivers are saying unless government is ready to take up the cost, they don't see how it is possible to reduce the number of passengers that they are supposed to take. As if this is just about the president seeking a protection for himself.
No, then we must brace up for a total lockdown, because then if the rule is passed that if, and sometimes people must be forced to protect themselves. That's where the power of the state comes in. Okay. Because if people would not obey simple instructions, and you are just looking at profit, to what end? You, the driver, you are going to get infected. Your conductor is going to get infected because you are carrying a lot of people and they are not spaced. So I think we must enforce certain rules so that, for instance, we should say only 2 passengers per the row, so that there's that social distancing. Windows must be fully open to ensure aeration within. And if these are not complied with, then the ultimate thing will have to be that transport system may have to be shutting down. And I don't think we want to get there.
All right.
And if people see the consequences, I think the other thing is we need to carry everybody along.
Right. Thank you very much. Let me introduce our next guest who just joined us and in place of Dr. Patrick Abuaji. Here is pharmacist George Yeboah Kessie, Managing Director and Consultant, and George has 15 years of experience in various sectors of the pharmaceutical industry in various roles. A pharmacist by profession, that's what he does, with MSc in Health Services Administration and currently enrolled in an executive MBA at Lancaster University. Okay, so there's a lot I can tell you about, and globally, how he's managing certain entities across the, particularly the African continent. Dr. George Yeboah Kessie, thank you very much for joining us.
Thank you.
Mr. George Yeboah Kessie. Mr. George Yeboah Kessie. Thank you very much for joining us. Now, my question to you will be perhaps to start from the point of view of the pharmacist. In the UK, they are beginning to record what we are told is the exponential numbers. As they begin to do that, the state is distributing for free the PPEs to pharmacies. And I ask myself, in Ghana, that is where it does appear what we should be doing first, because many people, their first port of call when they have an issue is to go to a pharmacy rather than to go to a hospital. So what would you say about that as far as protecting those people and in turn protecting everybody else? This show is brought to you by MTN everywhere you go. Bank of Africa, strong as a group and close as a partner. Amen Scientific, God is the healer. Duraplast, where Duraplast goes, water flows. COAFS, your immune booster. Waylead, we build homes for you. And Joy Learning, keep learning. We'll talk about Joy Learning also because it does appear that this is the time that everybody will want to take advantage of the Joy Learning platform. That's a school. So that if your children are at home, one of the first things I did when the president made the announcement about the closure of the schools was to quickly call one of the installers to get one for SHS, student who is now at home. And practically, if you don't occupy them with this, you may never know how it goes. All right, so what do you say? What is the role of the pharmacist in this pandemic, containment, control, and what can the states do?
Samson, thank you very much. It's true what you said about the UK. In fact, coming this morning, I just learned they are almost running out of paracetamol, which is almost ahead of thing in that part of the world. And that should tell you the kind of seriousness the situation presents now. And frankly, I think in Ghana it's even more precarious for us because with our primary health care, pharmacies are almost the first point of call, especially for the kind of symptoms that this disease presents. And looking at what we've done so far, I must say I'm not really impressed, especially about the kind of coordination that's supposed to come up. Majority of our pharmacy services are provided by the private sector. And that's where government needs to step up now and do a lot of collaboration with our pharmacy service providers. I also expect a lot of leadership from our professional bodies. And this is the time where we expect leadership from all fronts, especially from healthcare workers and our service providers and professional bodies. I expect that the Pharmaceutical Society should have a way of bringing all the community pharmacy service providers together and putting up a kind of plan on how they are going to engage the public as the first point of call when they walk into the pharmacies. I mean, I've had people call me with symptoms that they've read online, similar to COVID that they're exhibiting, and they don't know where to go. In fact, most of them, the first point of call is the pharmacy, and they are told to go to a hospital. But they should, because the pharmacists don't know what to do when patients walk in, it becomes an issue of should you treat, should you refer them to a hospital, should you tell them to go back home, because this disease does not have a treatment. There's no treatment for it. The only way we can stop this is to get people from infecting others. And so we need to get our pharmacies, especially community pharmacies, up to task on how they can advise people when they present with such symptoms. And I think this is the time a lot of coordination and collaboration is needed, especially between the government and the private sector on this.
Very, very interesting. Now, by the time we started this program at 9 this morning, I was giving you the updates, the coronavirus cases globally. The recorded cases were 277,000 plus. Then when we got to about an hour into the show, it shot up to 278,000 plus. As we speak, it is 279,000 plus. I do this to give you an idea of what we are dealing with and to bring your mind present at home to the preventative measures that we are all supposed to practice. Wash your hands under running water for at least 20-30 seconds with soap. And then, in the absence of that, make sure you have your sanitizers alcohol base, at least 70% alcohol base, 60-70% alcohol base. But washing is the most effective. In the absence of that, do that. Once again, don't touch your face the most difficult commandment to obey. Do not touch your face, because as you touch your face, we know that the disease, the virus, enters through the eyes, the nose, and the mouth, and it settles at the throat, at the trachea, and also can attack the esophagus. And these are the places when it attacks, it causes you the inability to breathe, because it blocks that opportunity as it mixes with the fluid or the mucus you find there. And you can't breathe out, and you have a difficulty taking in air. We shouldn't get there. So let's practice these precautions very effective. The president had a meeting with the industry players, particularly in the pharmaceutical industry. What good are we expecting out of that? Of course, we have the governor of the Bank of Ghana and other people giving assurances that money will be made available once you are ready to locally manufacture the things that we need. We know that you may not get the PPEs from outside of this country, because those who are doing it need them and they don't have them in good numbers.
So, Samson, I think that was a good start and it sends a good signal. But beyond that, you cannot build systems overnight, and you cannot really isolate your systems from the general situation. So currently, what we have is what we have to rely on. Do we know how much of a drug stock we need to be able to survive through this period? Do we really know how much of stocks of the medications we need available? Do we know how we are going to service people? For example, the disease is mostly very virulent to people who are on chronic diseases.
Right,
so,
Dr. Bayu and
which is
Dr. Puaji just
one of
mentioned
our
that.
growing burdens. I mean, 7 out of 10 middle income to higher income families in Ghana have a chronic disease. So these are the people who are going to put a
Say that again. 7 out of 10
middle to higher income families
in Ghana.
In Ghana, they either have hypertension, diabetes, stroke, or cancer.
Okay.
So these are the families who are going to be a burden on our system should the disease get out of hand.
But again, it's important to know that we are learning that whilst initially the idea was that it is the elderly that are most vulnerable and being killed by the disease, the younger ones are also suffering the disease, even though the death rate, as far as the younger people is concerned, is lower.
Yeah.
You know, and
they spread it more.
Yes, and the thing
Okay.
about this disease is not the death rate. People keep comparing the death rate to cholera, and that's not the problem. The problem is the transmission rate. Because the transmission rate is so high, people get sick and very sick so quickly. So if you look at the extrapolation they've done, even looking at the current case, and I was just using a study that the Harvard Medical School did, based on the current transmission rate that we have in Ghana now, and based on the extrapolations they've done, by the end of 30 days in Ghana, we should expect about 32,000 people with the virus exhibiting symptoms. That's at the current rate of 19 that we have. So if you have 32,000 people exhibiting symptoms, and all of them need medical care, just imagine the burden you are placing on your health system.
How do you make these estimations? Sorry I'm asking, but I have followed elsewhere, and I see how they make it quite close to what they expect. They know that this number of people will be infected, and we should work towards reducing that number or containing a certain number. How did you do that? What you just
So, based on the latest extrapolation they've done, every infected person that is detected, there are about 10 more that are not detected. So, if you even take, and the rate of transmission is 2 times, it doubles every 3 days. So, even if you take the people that you've detected and extrapolate that they've infected twice that number every 3 days, you can get quite a fair estimate of the number of people who are walking around and going to start exhibiting symptoms in the next 30 days. And that's very alarming.
Scary.
And the fact is, at that point, you would need a lockdown. Don't forget that in that midst of that lockdown, there are people who need drugs, because there are lots of people on chronic diseases. There are people who would need who would also get sick within that period. Just imagine you are in lockdown and your child has a broken arm. The doctors who are supposed to look at you are taking care of COVID patients. And that's where it becomes very stressful on our health system. And that's where it becomes even more stressful on every other sector of the economy. I don't think we should get there.
All right. Dr. Bayo, this is where elsewhere, I think in Ghana, you have also made those announcements. Surgeries and so on have been suspended.
Yes.
Can you explain what that means? Because are you saying that people don't have a life and death situation and you are saying hold on because we have to take care of this situation before?
No, so what we have done seeks to achieve only two objectives. The first one is to reduce the risk of transmission in hospital. And the second is decongestion in preparation for higher numbers of people who need care because of COVID-19. And so when you look at the risk, reducing the risk of transmission, we are saying that our outpatient department, for instance, is a very fertile ground.
Right.
People are coming in who are sick and they are sitting there in large numbers in drones and they are very close to each other. So should one person walk in there with a condition, before we try the person and do all of that, that person can infect a lot of people there. And so the outpatient clinics are being decongested. So if you have a chronic condition, we are saying, is it possible we can do an arrangement where you can get a drug refill at the nearby community pharmacy instead of coming to the hospital? If you have a condition, can we schedule your appointment so that we have, let's say, 20 people per time at the outpatient department so we don't have a lot of people? Now, when you come to the decongestion base with surgeries, what we are trying to do is we have what we call elective planned surgeries that are not very urgent, but these surgeries have the potential to populate our ICUs, which is where when we have the severe to critical cases of COVID-19, they'll be managed.
Right.
So if you have a condition that you could have had the surgery in a year, or you can have it in 6 months, why should we do it now at this critical time? So they are the ones that we are asking the surgeries being rescheduled, so that at least our ICU spaces are freed up in case of these critical conditions coming in. Like you mentioned with the Italian situation, it will be very difficult if you have 10 ICU beds and they are all occupied and you now have people with critical to severe disease. Who do you take off? Who are you signing off their death warrant? It will be difficult. So it is a preparatory step that decongests the system. So critical conditions are still coming in. If you need to have your medications that you cannot get from the community pharmacy, or there's a need for a change in dose or anything that you need to see a physician, that access is still there. But we are asking people to deploy ICTs to have an appointment system in our outpatient basis so that there's no congestion. And then the surgeries bed so that we don't populate our ICU space. So that is what that directive or policy is. Yeah.
Interesting. Scary, but we
we are not in normal times.
Like the hashtag is, we should preach calm.
Yeah.
But I say, if we know of the facts, and the facts are difficult facts, we are better off sharing those facts. And if those facts provoked the necessary fear of God in those who must do the right things, we are better off doing it that way than being hush-hush about it, and then we get overwhelmed and perhaps we get damned because health facilities where we know they have the best are overwhelmed.
True.
As we speak. And they are simply choosing who should die and who we want to take care of. How can we do differently and better the situation? Yes, you wanted to say something.
Just to put in, so when people say we are being alarmist in trying to sound the warning, I think maybe they are not really having a good idea of the reality of the situation.
Okay.
This is not cholera.
Right.
This is not Ebola. In fact, this virus is such that it will overwhelm our system because it is not a virus.
You are not saying it may, you are saying it will.
It will. In fact, you cannot stop the spread unless you shut down. The only way you can stop the transmission of this virus is to isolate people because there's no treatment. Hand washing, hygiene slows the spread, but it does not stop the spread. In fact, all the evidence from those who have gone through this, China, Singapore, currently Italy, France, they have to get to a point where they lock everybody down. Because that's the only way you can solve the transmission of this virus. So if it's either we do that now and we bear the consequences, or we do that later when we are overwhelmed, because we will get there.
I trust that we will not get to as much as they have been exposed. It's my prayer, because as I follow, and I follow what's going on in Italy, this should never come anywhere close to us. But 600 dying in 10 hours.
It's not a wish. It's not a wish list. I mean, there are practical measures.
No, there must be something in us that should stop that. Because we'll be damned if it happened.
And I think the Minister of Health himself yesterday stated that the truth is we cannot be overconfident about this. Our system cannot cope when we get to a certain level. The honest truth is there. And we all agree. I mean, you were giving us some statistics about the number of ICU beds we have. If we have 30,000 people infected with this condition, if they are all exhibiting only mild symptoms, we are good to go. They will isolate at home, no problem. But if they are exhibiting severe to critical symptoms, at that level where they need a respirator, a ventilator to breathe for them, truth is the system cannot cope. And that is where we are going to have trouble. And that is why I think that we must take drastic measures now. And those drastic measures, we should not think about the politics of it. And I think that when the managers of our system speak the truth to everybody, people will come along, because we know what the future holds for us if we do not. I mean, the examples are there for us to learn from. And I think that if you come out with a clear policy and tell people that, look, we are doing it because of A, B, C, and people know the true situation, that, I mean, I talk about the communication to health workers. As of now, we have some hospitals that when there's a suspected case, people are afraid because the PPEs they need to wear may not be available. So how is that communication? Let us know. In the entire country, we have 10,000 PPEs. We are only giving them when you have a critical or a suspected case. We are not getting any more for now. This is the truth. Then the people understand what the situation. Then we all can reason out, okay, look, PPEs are in short supply. So only these hospitals can handle the situation. But to the extent that that communication doesn't come, then people feed on whatever information they have. And then
do we have the capacity to improvise in some of these situations? Because I'm looking elsewhere and they are improvising.
There is the need for improvisation, but that also means that, and I mentioned this last week, I made a call here that the NHIA must pay hospitals and pharmacists, because you cannot deprive the people of resources and ask for improvisation. If you manage a hospital, this is the time you want to stock up, and you are owing all your suppliers. How do you stock up essential medications?
What can the pharmacy field, what can you do about, because there is the real danger of not being able to get anything from outside, at least not anytime soon.
So, Samson, this is where it becomes very clear the kind of systems we've built for ourselves as a people. I think I mentioned, if we even are aware of the kind of drugs we need to stock up and what quantities we need to stock up. Basic, you need data. To be able to plan, to be able to do anything, you need data. Currently, how our, and he mentioned NHI, which is very significant, how our pharmacies get to stock their drugs is even a problem, because the supply chain is so fragmented. So there's no coordination. There's no one who can tell that this drug is needed here at this time.
This is not what I want to hear. This is not what Ghanaians want to hear.
And it's not too late. It can be remedied.
Good.
But we should start now. We should be doing something now. This is where I call on industry captains to put their act together. We need leadership on all fronts on this level.
They should do what exactly?
They should put their members together and form a plan on how they are going to help the community combat this.
That's where you are. You are the lead consultant.
For example,
Royal Crown Consult.
The Community Pharmacists Association.
So don't be saying they should, because you are a key stakeholder.
I am a stakeholder, but I'm talking as an industry player who is calling on our members to do something about the situation.
All right.
I feel the Community Pharmacists Association should come together and find a way of coordinating themselves on how they are going to stock up and provide service. If they should approach the government, and this is where I commend the government for sitting down with industry players, but I should go beyond that. What are they doing to make sure that all the community pharmacies are stocked up, resourced to help people when they get isolated in their homes with what they will need? For now, there are certain medications that are going to be in high demand, whether for a good cause or not. It is going to happen. Paracetamol, cough and cold medications, these are going to run out. And we need people to be assured that there's a system in place to take care of them when these things come up.
All right. We will take a quick break, and when we return, we would look at, and we would want you to interact with us and tell us how you are practicing the preventative, measures that are being communicated, use of our trotros. How are you managing the situation? Because we don't have a shutdown, even though that is what the professionals seem to suggest is the way out. But it can be done in certain phases, in a way that we are all safe. The cost of very simple things that we need, sanitizers, what is going on? People are seeking to profit so badly in the situation. What can we all do? Veronica buckets, how much did they cost yesterday? How much are they going for today? Why is all of this happening, and how can we reduce some of these situations? Get involved, and let's hear from you also. Remember that 112 is the emergency line that is available if there is a suspected case. We'll be right back. This is Newsfile. You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. Now, the update on the global situation of recorded cases is 282,868. 282,868. That's the global situation presently. Dr. Titus Bayo and also Mr. George Yeboah Kese, MD and lead consultant, Royal Crown Consult, are guests presently assisting us to understand the situation now. And we will get on the phone lines and get to our next other guest that we are bringing on. Yes, actually speaking to him on Skype. And so for very good reasons, we decided that our studio will not, as usual, host 4 guests at a time, because we have to be very serious and intentional about social distancing. So now, before we get to our guest on the line, let me also let you know that this show is brought to you by MTN Everywhere You Go, Bank of Africa, as strong as a group and close as a partner, Amen Scientific, God is the healer, Duraplus, where Duraplus goes, water flows, COAFS, that is your immune booster, Waylead, they build homes for you, and Joy Learning, you just have to keep learning. Keep learning even in this circumstance, particularly at a time when it is expected, as the experts are saying, and they most likely will advise the government and the president that this may be what to do, a shutdown. But our system, is it the way we find elsewhere where they are announcing shutdowns? Are we able to do that? So whilst all of this is going on, I'll invite parents, guardians, that Joy Learning is intensifying teaching lessons in these times as the reported COVID-19 cases in Ghana rise and have compelled the president to announce closure of schools. You can tune your television channel to Joy Learning and access the classroom lessons and other educational programs. You can be assured that with Joy Learning, your children will not be left behind in the classroom teaching while in the house. Do not allow COVID-19 to prevent your child from learning. Joy Learning has you covered. So just tune in. All you need is get a multi-TV digibox for your kids right now. Joy Learning has education in the SS and JHS and the best of teachers who are offering that education. So you have to pay attention. Now, before we go on the phone lines, there are a number of views that have come up. What the president actually did is sort of a state of emergency he has announced, but in different forms and shape. The civil society organization, One Ghana Movement, asked the president, I think yesterday, in a statement, that he should formally declare a state of emergency under Article 31 of the Constitution for the remainder of the president's 4-week shutdown and take the necessary consequential actions to preserve life and health, including decrowding the business districts of our towns and cities as contemplated under the provisions. Of course, they asked that the president should stop the errant institutions from the registrations and public activities in which citizens are called upon to engage in a public exercise under the superintendence of said institutions. Then they asked that the president should order a closure of Ghana's borders and cancel all flights from foreign countries for the next 30 days, except for returning Ghanaians and essential UN workers or novel COVID-19 medical support missions. Maybe, Mr. Kessie, you can assist us here. Can we do a shutdown as a nation? And if we have to do it, is there not some special way to go about it than what we're seeing? California, 40 million people shut down, stay home, don't go anywhere. We can't do that.
Something, I think in reality, and the call by the body that you just mentioned is also more or less...
That's One Ghana Movement.
Yes,
yeah.
It's more or less a politically correct way of just asking for a shutdown. Because frankly, that is the only way out. No country or no region has been able to go through this epidemic without a shutdown. And the lessons are clear for everybody. It's either we shut down now or we shut down after 3,000 people have died. But the shutdown is inevitable because that's the only way you can control the transmission of the disease. You cannot control it by washing hands. You cannot control it by hygiene. You can only control it by isolation. So it's either we plan towards shutdown now or we plan towards shutdown after our systems have been run down. I feel that all our resources now should be put towards supporting people for a shutdown. And this is where I think government should demonstrate leadership in putting private sector together to support people for a shutdown. We cannot run away from it. We cannot beef up our systems. It's too late. We cannot build more hospitals. We cannot improve our bed capacity. We cannot train more doctors. It's too late. All we can do is prevent the transmission. And that cannot be done with a shutdown, without a shutdown. So I think we should start preparing the minds of the public and we should start devoting all our resources towards supporting people in a shutdown?
Okay, I'll bring in my next guest, but I would like you to have your take on the issue about a shutdown, because I am looking at where shutdowns have been effected. The systems are there. We don't seem to have the systems. How many days, for example, can we say we have a shutdown and a complete shutdown? If we're going to have that, should it be a partial? How is it supposed to be done? I'll come to you shortly, Dr. Bayo, but let's bring our next guest, who is a lecturer, Global Health Department, School of Public Health, KNUST, leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicines. Of course, he has a background in epidemiology and cryptococcidiosis. That's where I am found wanting. Thankfully, the physician who is joining us now holds 2 masters and a PhD in health research and policy. I'm talking about Dr. John Amoisi. Thank you very much for joining us on Newsfile, sir.
Thank you very much.
Right. By your assessment, what do we find ourselves in, and what should we be doing? Are we doing that?
Well, I'd like to start by sending greetings to all your listeners who are joining this morning. I think it's really great that we can reach out to them with critical information. I'd also like to thank the panelists who have come before for the really solid information that they have provided to the listeners. I think everything is really spot on, and this is the kind of thing that we should be doing. And I feel like almost everything has been said already. But particularly, one thing that I would like to highlight is our need to showcase or make more visible what is being done at the national level. I must say that the Ghana Health Service, the Ministry of Health, and others have really put in a lot of effort to make sure that what we can do with what we have is optimized. You heard about the contact tracing that is going on. Unfortunately, not many people know about this and the detail which is going into these kinds of activities. Of course, it's a fine balance between telling people all that you're doing and also restricting information, because information has a way also of inducing fear and panic if it is not managed correctly. But the fact is, as your most recent contributor mentioned, is that we are in perilous times for various reasons, and the reality on the ground is just as the previous speaker made mention of. We are sort of inching slowly towards the probability of a shutdown, and under these circumstances, given the time we have left, perhaps a lot of effort will have to be dedicated towards how we'll be able to live out a shutdown. Of course, we cannot put up emergency structures or significant emergency structures within the next couple of weeks. It would take a little more than that, but we could mobilize a bit better if the trajectory continues, as we are seeing now with 19 cases, we will be inching towards that. But I also want to just touch on a couple of things regarding the approach we are taking to addressing this problem. You've heard about the public health approach, which is your classic disease control approach at various levels, which is really the way things should be. You've heard about the challenges that we are facing and will face when it comes to the clinical care. And this is twofold. One is the health workers themselves, their preparedness, and aside their preparedness, how well equipped they may be with the necessary gear. We have some gear. The question is, will the cases that we will have overwhelm the capacity that we have presently? And you can look as far as the need for more sophisticated interventions like ventilators and so on, which is something that we do not have enough of, obviously, and so that perhaps is not one of the options on our plate. But the area where I want to come in, which has not been mentioned yet, is in the area of research, and that is what I do, and that's what a lot of us academics do. I'm at the School of Public Health here at the KNUST and also at the KCCR, where I lead my research group in global health and infectious diseases. And you realize that this disease, as yet, has hardly been characterized in Africa. We've had research and information coming out of China and information coming out of Europe. Even very recently, there's been information published on, low-end clinical trials of chloroquine, for example. But there's hardly been any information from Africa. And diseases affect populations in different ways for various reasons. One would be the genetic makeup and other constitutional factors. Others would also be just the geographic location and the lifestyles of the individuals. So it is very important that as we go through this process, we also set up systems that will collect information in a very systematic way so that we learn as we go. And this is the role that we are happy to play as researchers. And I'm very happy to say that the Ghana Health Service has already been very, very collaborative, as some of us have started trying to put up structures and systems in place to be able to start doing research so that the research feeds into the decisions that are taken so that we can take decisions that really are peculiar to where we find ourselves. Already we know from Italy that this disease is affecting males twice as more than females, or shall I say, is killing males twice as much as females in all age groups. Now, this information was not available from China, but we're seeing it from Italy. What new information will come out of Africa? If we do not set up the structures to conduct the research as we move along, we will miss this, and we'll also miss a chance to perhaps put in measures that are peculiar to our situation to address this current crisis.
So, yes, we have heard, for example, Boris Johnson say that we could be out of this in 12 months by way of getting solution. But he says that depends on the collective efforts. How soon do you think, from what you have seen so far, that a solution could emerge?
I'll say that as a researcher, we always say that you can only be certain about how uncertain you are. So anything that is said really falls within a certain range of confidence that could be very wide. And it's almost impossible, especially for where we sit now in Africa, to be able to predict with any amount of accuracy when this will be over, because things could change in a week and that could have implications. So we can only speak to what we see right now. From what we see right now, it is very clear, without any shadow of doubt, that there will be more cases. How many more, we cannot tell, but there will be certainly twice as more. This is guaranteed. But whether it be 3 times, 5 times, 100 times, we just cannot tell. It all depends on the measures that we put in place. Now, getting out of it beyond just the biomedical aspect of it or the virus not affecting so many people is the socioeconomic consequences. And that is something else that we will need to pay attention to. Stimulus packages and other things. Well, that's not specifically my area, but just coming out of it is a whole process. And the country or the world getting back on its feet will certainly take more than 12 months. But as for the disease itself and its transmission, we cannot tell at this stage when it will go away. We've been talking about epidemic curves and all this kind of thing. The truth is the curves act differently in different locations. So the fact that it happened in China, spent about 2 months at the top and started going down, doesn't mean it's going to be the same. Already we can see the number of deaths in Italy has surpassed that of China, even though they have a much lower population. So the curve is acting very differently in Italy. How is that curve going to act in our part of the world? It could be steeper, it could be flatter, we don't know. So what we can do is what we know, which is measures we put in place to prevent transmission.
Do you share the view that our health system is set to be overwhelmed?
What I'll say is our health system has the potential to be overwhelmed. It will be overwhelmed when the number of cases exceeds the capacity of our health system. The rate at which we are going, the number of cases will increase. Right now, as we speak, there are enough beds in various facilities all over the country to take care of cases. But when the cases go beyond a certain point, this will not be possible. We already saw this in China, in Italy, and other parts of the world. The good thing is China was able to put up a 1,000-bed hospital in barely a week.
Right.
All right. Italy has people in the corridors, has people in the reception areas. All right. So I will not say for sure we are guaranteed to have a health system that will be overwhelmed. If you look at the direction in which we are going, there is huge potential for that. But no one with certainty can say that this will happen because we do not know. It doesn't mean we should be complacent,
right?
But we have the potential. And once you have the potential, you put the measures in place to ensure that you don't get there.
Italy has been criticized for perhaps taking things for granted at the start, and that America appears to be falling in the same danger. Do you think that is where we are going?
I wouldn't say that we have taken things for granted. At the high level, you can see the effort that is being put into sensitizing people, putting structures in place. But the question is, to what degree is this filtering down? We're having this discussion right now on a prime radio station, Joy, which goes nationwide, even goes outside the country. The question is, what percentage of our populace is able to tap into the rich information that is being provided right now? Majority of our people engage better in the local dialect, in the different local dialects. Who are the people who are speaking right now in these local dialects, pushing this information across? I liked what one of your panelists said regarding the practicality of self-isolation and quarantine in our part of the world. Certainly there's a way we could be able to do it, but who is going to communicate these to the people down there? So I would say that we need to engage with our socio-anthropologists, social scientists, our behavior change and communication experts, and there are many of these kinds of people in academia here at KNUST and in universities all over the country to begin to, as quickly as possible, design the messages in the local language, design messages that will come across in our transport system, right, so that the information can really filter down. But we're doing everything right so far to the best of our ability, okay, but to what degree is it filtering down? This is the worry.
Doc, what will be your final word to everybody to practically take control of their lives and also the lives of relatives and friends to avoid, COVID-19?
Well, what I'll say is that this disease is not a joke. And as one of your panelists said, it's not cholera, it's not Ebola, and it's not SARS. At least it's not SARS-1. This is actually a type of SARS, but it's SARS-2. And it's one that spreads so fast. And we need to take responsibility as individuals. There's so much that the government can do. There's so much high-level measures that can be put in place. But there is also a role for individuals to play. I received a call from a friend who said he had an uncle who had returned from Germany just on Tuesday. This uncle is coughing and sneezing, and this uncle is all over the place. This uncle is educated but will not stay at home. I said, look, call your uncle, tell him to stay at home. And if uncle doesn't want to stay at home, I'll give you some numbers to call so they can haul him in, because it's wrong. And until we begin to be responsible as individuals to recognize that we have a role to play, things will get difficult. So what I'll say is that we're happy about whatever is going on at the national level. We'll encourage and stand behind our health workers and all those putting things in place. We will criticize them and encourage them to do more, but there's much more that every single Ghanaian has to do to stay safe and also to call out those who are doing things that will make all of us or put all of us in danger.
Thank you very much, Dr. John Amonsi, for your time and for assisting our global audience to appreciate what this is and to speak also to authority and leaders to take the necessary steps. Thank you very much indeed. And if I come back to the studio, I really want us to take a quick break, and then when we return, we can now have all of you, wherever you are listening, to join us by phone call. You can send us messages or you can call into the show and let's have your experience. And if you have any questions for Mr. Kessie and also for Dr. Bayo, we will welcome them. The numbers to call 0302 211 691, 0302 211 692. So it's 0302 211 691 or 0302 211 692. You can call us right after this break. We'll take your questions directly and then we'll deal with the other matters that we have at hand. You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. Please wash your hands at least for 20 to 30 seconds thoroughly under running water with soap. In the absence of that, make sure you have some sanitizer. And the hand sanitizer at least should be alcohol-based, 70%. At least of alcohol. Don't touch your face. The most difficult commandment to obey. Don't touch your face, but it is important. Now the phone lines have been activated. The phone lines have been activated. Let's have you call. Alhaji Hamza from Nima. Good morning and welcome to Newsfile.
Good morning, Samson.
Yes. What's your question?
Yes,
what's your contribution?
Yes, what I have is that if the government can take a decision by, because yesterday I was at T3, I saw so many people traveling away, so many people coming in at our airport. If the government can, put measures on that one, either not people to come in, because you can't know who has that disease. And in fact,
there's a travel ban already in place, which has been reinforced.
The way your panelists explained is very,
okay. Thank you, Hamza from Nima. Let's go to Farouk in Tema. Hello, Farouk.
Hello, good morning, Samson.
Yes, you have a question or contribution. What exactly are you doing to stay safe?
I have contribution or question.
Okay. Quick.
Yeah, my question is, I've heard, just learned on social media that lemon, cutting lemon, you soak them in hot water and drink in the morning helps boost your immune system. I actually want to know if, how true is that? And I actually want to urge Ghanaians, let us take this thing serious, because even the nations with these huge, scientists and with these huge resources are finding it very difficult fighting this virus.
Okay.
So let's stay united in these hard times and let's do away with the,
Thank you. Thank you very much. Thank you, Farouk. Obin Sechi, Oda. Obin, let's hear you.
Okay, good morning, Samson.
Yes, go ahead. Let's hear you.
To your panelists as well.
Okay.
And what I want to say is, can't the government implement any law to quarantine those who come into the country? Because it looks as if when you ask someone to do self-quarantine, they feel reluctant to do it. As one of your panelists just said, the man on the sky, Mr. John Amweti, was saying, his friend's neighbor, let's say relative, came from outside and he asked him to quarantine himself, and he's going about doing his own business. So can government bear the cost now to quarantine them that come to the country?
Okay, thank you very much. Thank you very much, Obing. It is in respect of that the imposition of restrictions bill was passed last night, hopefully to give the president the power to do a few things, even though there are those who disagree that that could be done without this particular process. Richard from Zabila. Richard. Yes, Richard, good morning. Let's hear you.
Good morning. Please, my problem has to do with the it's actually limited to Kumasi and Accra. Nakongo has research, and then I think there's another research center to Champo, which are equal very well. Is it that they cannot be resourced equally care of the northern part of the country?
Thank you. Thank you very much. The Ghana Health Service says there will be 2 more in the northern and where? Okay. Yes, Vincent. Vincent Donkokrum. Vincent, what's your question or contribution?
My question is, what is the Ghana Health Service doing for health workers and the nurses and doctors? I can say and commend the general manager of the Presbyterian Hospital in Donkokrum. He is doing wonderfully well, preparing towards any mishap. But what is the Ghana Health Service doing to make nurses and doctors and to say that the whole health workers are secure?
Okay, thank you very much. So we paused here and then we get answers to your questions, 5 of you, and then when we are done, we'll take some more questions. This is what we are doing at this time. So if you want to call, please hold on. Once they are done with answers to your questions, then we will pick your calls again. So, Dr. Bayo, Hamza is asking for a travel ban. That's already in place, right?
Yeah, I think that is in place. If anything at all, we will need an enhanced form internally.
Right.
That is when we are talking about the
lockdown. That is internal travels.
Yes. That's
particularly, what are you looking at? Air or?
No, not air. Air, yes, in there as well. But when we look at the social distancing, we have to get to a point where in our trotros, we can practice that spacing. Either they are practicing it or we are in a lockdown and no trotros are allowed to move.
Okay.
Because it will serve as a very good environment for transmission. But
there's a problem with air circulation in the small planes that we are using for internal,
Exactly. So that risk is there. I noticed I think Africa World also announced they are cancelling their Abidjan and other routes. I think that pretty soon measures should come out for internal ones, so that for non-essential movement, all that should cease.
Okay.
Yeah.
Thank you. Then Farouk says lemon in hot water to boost the immune system.
Let me just use this to talk to Farouk and everybody else. Eat a healthy, balanced diet to build a very good immune system. All these remedies coming up have not been proven. We've had people come up, and I have people calling me, can I go and buy, what's the best immune booster to buy and all of that. I think all you need is eat well, rest well, very well balanced diet, have a very good sleep.
But it's not bad to have some supplements, vitamin C, for example.
Yeah, no, it's not bad.
Okay.
Vitamin supplements are welcome.
Right.
But a very good diet and a good rest and a good sleep, because your immune system rewinds when you sleep.
Yeah.
So you need a good sleep.
Richard was asking about Kintampo. He says there's a research center there. Yeah. Can't it be improved? But
I think the Ghana Health Service Director General mentioned they are going to enhance it. He said 2 additional centers. The Medical Association has called that it should be regional.
Okay.
So that at least you can have testing across the country. I know there's a Kintampo Research Center, there's a research center at Navrongo. Their capacity may not be able to do these PCRs, but if we decentralize the PCR with mobile technology, they should be able to conduct some of the testing.
And Vincent asked a question which had been answered by the director of the Ghana Health Service already about what they are doing for the health workers. Thank you for that. But before we took the break, I was asking whether if we should have a ban or a shutdown like Mr. Kessie is suggesting, how could it be done? Should we do that in the first place?
Yeah, so I think a lockdown may be necessary, but if we are doing that, I would consider currently almost all our cases have come from the Greater Accra region and the Ashanti region. These are where we've had cases.
There was one in Temaizan also?
Yes, and it's still within Greater Accra. And so I think that we may want to consider, if we are doing a lockdown, these places which are the hotspots. In fact, we have called for what we call an infograph from the public health people to tell us where the hotspots are. These people who currently are treating themselves at home, where do they live? The people who have come out, where are they? So that even for the clinician, if a case comes to you, you can see closer to where we have cases reported.
So that there will be a partial lockdown, that's what you're saying?
I am thinking
or strategic.
A strategic lockdown. And we may begin by things like our transport system, where if you, for instance, say, trotros that move between from region to region, or buses that move in that, if once those are curtailed, there's some form of lockdown.
Okay.
If you lock down the central business districts, then mass movement of people will go down, because it's very difficult to say that people should not move. But there are some things once you do indirectly, there is some form of a lockdown. So if you say the central markets where people congregate should shut down, or they should not admit a certain number of people in a day, that's the form of a partial lockdown.
Elsewhere, where even the cities have turned into ghost cities, you see that some of the lockdown is not complete.
Yes.
You are allowed to go out for essentials.
Things. So that can happen. But for us, so if we had an efficient public transport system, you shut that down and you have achieved some level of lockdown. Without that public transport system, it comes down to our trotros and our taxis. If you impose a certain ban on number of passengers they can carry or where they can go to, and restrict movement in the central business district, immediately we have a partial lockdown.
George, what do you say? There are questions being asked. Yes, he's the clinician, but I'd like to have your view on that as well. Questions being asked about whether if you use clothing, secondhand stuff that we all like to buy a lot, including plates. Should I visit my barber, for example? Women, should they go to the salon? I had to make a decision. I needed to trim up. I have my own, clippers and all of that, but I didn't go to my barber. Yes, so what do you say about those?
So this brings me to my initial statement I made when I came here, that we should not present this pandemic as the same as cholera or Ebola. This is not a hygienic problem. Hygiene helps to prevent the spread. But this virus is not a hygienic problem. So keeping personal hygiene would help. But the only solution, proven solution, is isolation. So you going to your barber, fine, you might keep all the hygienic instances, but what if he coughs on you? So it's not a problem of keeping hygiene is very important, it's very good. It helps slow down the transmission rate. But the real solution is keeping ourselves from intermingling with each other and spreading the disease. And I think that kind of messaging is what should go out, because that's what's needed now. The focus, hygiene is good, but the focus should be on social distance.
Yeah, I'll get Dr. Yes, what do you say about that?
I was just going to say that I support exactly what he's saying, but just to put out that the current data shows us that this virus can stay as an aerosol for 3 hours.
What does that mean, aerosol for 3 hours?
Like as droplets that come out of us when we sneeze and cough, it can be active in that space for about 3 hours. So that means that if you are in an air-conditioned enclosed place where there's no free ventilation, someone coughs and sneezes out and has virus in the droplets, it can last there for 3 hours. On copper, it can stay up to 4 hours. On cardboards, it's been shown that it can stay there for 24 hours. On a stainless steel, it can stay for 48 hours. And on plastics, it can go as much as 72 hours. So it means that on all these surfaces I've mentioned, droplets can land there, they can be contaminated, and they can stay there for a long time. So if you practice the hand hygiene of not touching, and when you touch, wash, then you are not likely to inoculate yourself. But when you enter a place and like your barber, as you mentioned, you may clean your hands, do everything, and as you mentioned, if your barber coughs or another client in there coughs, the person might even be observing the social distance with you. But if the person coughs, this aerosol can stay there for 3 hours. You are breathing in, you have no nose masks on. It means you can inhale them. So the best is for people who know that they have the infection, if they had a nose mask on, that would have kept all of us safe, because when they cough, their aerosol stays within the mask. But until such that we're able to test and know all those people, the safest is if it is not essential, let's start imposing some sort of self-restriction on ourselves.
So if a woman needs to go to the salon, if they have a face mask, that's good enough, so they can go, and as long as they can confirm that they are hairdresser or they are keeping to the practices.
Because we do not know who has and who does not have. If that going to the salon is not essential, suspended. That's what I would say. If you think it is so critical that if you got an infection you don't mind, then your benefit outweigh the risk in this case, then you can go.
Okay. Yes, and George, again, the concerns have come up about the cost of sanitizers, vitamin C. They are running and people are increasing the prices. Veronica buckets was about 120 Ghana cedis. Now it's being bought for 450 and so on. What can be done about these things?
So I think this is where we have to suspend the notion of free market, and government has to step in. In fact, this challenge is such that it requires a social response. That means everybody is part of the problem or is part of the solution. No industry is left out. Government meeting with industry leaders should be one of support. For example, those pharmaceutical companies that can provide hand sanitizers, government should give them tax breaks. They should be able to produce hand sanitizers at minimum cost so that they can give it out to the public for free.
Okay.
These are the kind of support systems that government can do to prevent the social cost that was going to
Okay,
come
so
out.
let's go back to the phone lines. I was putting together a number of questions that you have brought in by way of text messages, and they have responded to them as well. And talk about sanitizers. As we know, the FDA is doing quite a good job there. The FDA has tested and approved over 30 more sanitizers within 1 week. It is facilitating the process to ensure availability of sanitizers on the market, which will also help bring down the price. So this is also good. Yes, who do we have on the line? Let's take your question very brief. And if you want to share with us how you are coping whilst your children are not in school, as mothers more particularly, we would like to hear. And if you have a good way of ensuring homeschooling, that should all help others to take a cue. Yes, so we take more of your calls. And once again, talking about homeschooling, the Joy Learning Channel is available. Wolo TV, together with Joy Multimedia, are bringing education right at your doorstep in your homes. All you need is a multi-TV digibox, and you can have your children, your wards, enjoy non-truncation of their learning. Yes, Michael. Michael, where are you calling from? Let's have you. Hello, Michael. Okay. Yes, Michael, I can hear you. Michael, you are calling from Kumasi. Let's hear you, quick.
Okay. I just want to find out about the internet. It seems it's very slow, and if things are going to be locked down, how do we communicate very well? Because we have to rely on the internet very more.
Okay. Thank you very much, Michael. George wants to say something about that?
Yes.
Okay.
So I was going to speak on our preparedness towards a lockdown. And as I keep saying, for me,
so let me finish with the questions. Yes. Frank, yes, Agozume, Frank. Okay, we lost Frank. Frank called from Agozume. You can call back. In the next few minutes, we can pick your call. So Michael was asking about internet.
Yes. It's part of what I think government should be doing now, planning towards supporting industry to help towards a lockdown. One of the key areas will be communication. I think the telcos should be made to bear what is coming and how they can support in terms of helping with communication. I think he also mentioned the area of transport. This is where government should sit down with transport leaders and see what they can also do to help curb transport.
We have an assurance that the transport minister is doing so. John is calling from Laura. John, let's hear you.
Yeah, good morning, my brother.
Morning.
Yes, I also want to use this opportunity to ask one question. You know, Laura is a border town to Burkina Faso. And all the time, we all hear about this coronavirus issues. Right now, it's very risky. What about the security men putting in measure to protect or defend this thing?
Okay.
Because our neighbors from the Burkina Faso, especially, there is a galamsey going on there. And the Ghanaian people are going there to sell every day. And they're also coming here every day.
Okay.
So what are the security men putting in measure to protect this thing? Thank you very much.
Thank you very much. I'm sure that the authorities have heard you. Yes, Kwesi from Dansoman. Kwesi? Kwesi is calling from Dansoman. Kwesi, let's hear you. Okay, I suppose we lost Kwesi on the line. And Dr. Bayo, John, who called from Laura, expressed concern that I think you have raised some of these matters already. Let me pick my very last call from Odum. You are calling from Bojuase. Yes, let's hear you.
Yes, what I want to say is that parents should keep their children at home. Hello?
Yes, go ahead.
Yeah, what I want to say is I'm a teacher, and I would wish that parents would keep their children at home don't allow them to regather elsewhere at playgrounds. That's another fertile ground for transmission. So parents should please keep your children at home, give them work to do. I'm doing things.
Okay.
So no matter what the work is, give them some work to quarantine them at home. Thank you.
All right. Thank you very much, Mr. Odum. And the latest on the global situation is 284,008 so far. The deaths have also increased. Yes, Dr. Bayo, what do you have to say to the last group of callers and what they have to share?
Yeah, so I think with regards to the gentleman who called from Laura, I think the risk is real. It's not only Laura, we have Hamley, we have all the border towns. And I think we should be coming up rapidly with a decision now, whether we are locking down our land borders as well, so that if it's a total close, we know that we are doing that. I saw a notice, I think, from the Togolese that suggests that they want to close their borders. I think as a nation, we should look at what we would do, and I hope that the directive will come out in that extent. I support the kids staying at home, and not only the kids. At this point, if you do not have anything essential doing in town, and to such a time that we have either a lockdown declared, you as an individual should assume that everybody else around you might be infected, and therefore stay at home if it's not essential to move out. Only essential workers and things, people who really have to go out, should be thinking of going out. I think that bit, I really support it.
Okay. It's an all hands on deck situation, and as you can see, there are even manufacturers of different other products which are now going into hand sanitizers to assist. I have cited that even Casapreco, for example, is going into hand sanitizers. All of these will help. What do you have to say, George?
Yes, and I really would call for the professional bodies to come together and start supporting government to find a way of curbing the problem from getting bigger. I think this is the time we all need to come together and use our professional expertise. This is a communal problem. Nobody is immune from this. So we should not be making demands at this time. We should be finding solutions. How do we innovate our services to take care of the challenges so that we can bring aboard solutions that would help curb the transmission? Because we are all at risk.
Okay.
We are all at risk.
Yeah. Mayor Kofi says drones can also deliver the samples in record time, so we should be thinking about that. Already we are using the drones to do some work. Kobina Edu says, what happens with someone who shows symptoms in Navrongo? Okay, so you call the emergency lines. I'm sure they will direct you to a particular health facility.
And in fact, our health system is so decentralized.
Right.
At Navrongo, whichever district you find yourself, there's a disease control officer, and there'll be a local line you can call. But you can also call 112 and you'll be redirected.
Okay.
But there'll be a team that would come and help you have your sample taken.
All right.
And it can be transported.
Okay.
One very quick last. So people are walking around from pharmacy to pharmacy, facility to facility with symptoms. I would advise that if you show symptoms, stay at home and call the hotline. You'll be told what to do instead of moving around, and because every time you move around, you are more or less potentially infected.
All right. Anane Frimpong Kwabna says that good discussion. I'm an anesthetist, and I can say for a fact that we don't have ICU ventilators to put over 200 cases on in Ghana. How many ventilators has the Komfanochi Teaching Hospital, for example? As a health worker, that is part of my concern. Togbi Aklopi says that the emergency numbers don't seem to be working. Please don't call them unnecessarily. We understand that they really are working. Eja Adam says that the personal and environmental hygiene protocols are very important. Let's all take note of that. And thank you. We seem to have run out of time at this point. I'm Samson Ladi Ayenini. Thank you very much for your company. Always remember, wash your hands under running water with soap, at least for 30 seconds. You can use hand sanitizers as well. Most importantly, don't touch your face. If you have to sneeze, use tissue. If you don't have one, do so under the corner of your arm. My guests who are here now have been Dr. Titus Bayo with the Ghana Medical Association, and also Mr. George Yeboah Kese with Crown Consults. Thank you all very much. Have a good afternoon. You're welcome back. This is Newsfile. It's your most authoritative news analysis platform, and here on Newsfile we put Ghana first. Please wash your hands at least for 20 to 30 seconds thoroughly under running water with soap. In the absence of that, make sure you have some sanitizer, and the hand sanitizer at least should be alcohol based, 70% at least of alcohol. Don't touch your face. The most difficult commandment to obey. Don't touch your face, but it is important. Now the phone lines have been activated. The phone lines have been activated. Let's have you call. Alhaji Hamza from Nima. Good morning and welcome to Newsfile.
Good morning, Samson.
Yes. What's your question? What's your contribution?
Yes, what I have is that if the government can take a decision by, because yesterday I was at T3, I saw so many people traveling away, so many people coming in at our airport. If the government can, put measures on that one, either not people to come in, because you can't know who has that disease. And in fact,
there's a travel ban already in place, which has been reinforced.
The way your panelists explained is very,
okay. Thank you, Hamza from Nima. Let's go to Farouk from Tema. Hello, Farouk.
Hello, good morning, Samson.
Yes, you have a question or contribution. What exactly are you doing to stay safe?
I have contribution or question.
Okay. Quick.
Yeah, my question is, I've heard, just learned on social media that lemon, cutting lemon, you soak them in the hot water and drink in the morning, helps boost your immune system. I actually want to know if, how true is that? And I actually want to urge Ghanaians, let us take this thing serious, because even with the nations with these huge, scientists and with these huge resources, are finding it very difficult fighting this virus.
Okay.
So let's stay united in these hard times, and let's do away with the,
Thank you. Thank you very much. Thank you, Farouk. Obin Sechi, Oda. Obin, let's hear you.
Okay, good morning, Samson.
Yes, go ahead. Let's hear you.
To your panelists as well.
Okay.
And what I want to say is, can't the government implement any law to quarantine those who come into the country? Because it looks as if when you ask someone to do self-quarantine, they feel reluctant to do it. As one of the panelists just said, the man on the sky, Mr. John Amwesi, was saying, his friend's neighbor, let's say relative, came from outside and he asked him to quarantine himself, and he's going about living his own business. So can government bear the cost now to quarantine them that come to the country?
Okay, thank you very much. Thank you very much, Obing. It is in respect of that the imposition of restrictions bill was passed last night, hopefully to give the president the power to do a few things, even though there are those who disagree that that could be done without this particular process. Richard from Zabila. Richard. Yes, Richard, good morning. Let's hear you.
Good morning. Please, my problem has to do with the testing. It's like only limited to Kumasi and Accra. We no longer have research. And then I think there's another research center to Tambo, which are equally very well. Is it that they cannot be resourced equally take care of the northern part of the country?
Thank you.
Is concerned.
Thank you very much. The Ghana Health Service says there will be 2 more in the northern and where? Okay. Yes, Vincent. Vincent Donkokrum. Vincent, what's your question or contribution?
My question is, what is the Ghana Health Service doing for health workers and the nurses and doctors? I can say and commend the general manager of the Presbyterian Hospital in Donkokrom. He is doing wonderfully well preparing towards any mishap. But what is the Ghana Health Service doing to make nurses and doctors and to say that the whole health workers are secure?
Okay, thank you very much. So we pause there and then we get answers to your questions, 5 of you. And then when we are done, we'll take some more questions. This is what we are doing at this time. So if you want to call, please hold on. Once they are done with answers to your questions, then we will pick your calls again. So Dr. Bayo, Hamza is asking for a travel ban. That's already in place, right?
Yeah, I think that is in place. If anything at all, we will need an enhanced form internally.
Right.
That is when we are talking about the
that
lockdown.
Is internal travels.
Yes. That's
particularly, what are you looking at? Air or?
No, not air. Air, yes, in there as well. But when we look at the social distancing, we have to get to a point where in our trotros, we can practice that spacing. Either they are practicing it or we are in a lockdown and no trotros are allowed to move.
Okay.
Because it will serve as a very good environment for transmission. But
there's a problem with air circulation in the small planes that we are using for internal,
Exactly. So that risk is there. I noticed I think Africa World also announced they are cancelling their Abidjan and other routes. I think that pretty soon measures should come out for internal ones, so that for non-essential movement, all that should cease.
Okay.
Yeah.
Thank you. Then Farouk says lemon in hot water to boost the immune system.
Let me just use this to talk to Farouk and everybody else. Eat a healthy, balanced diet to build a very good immune system. All these remedies coming up have not been proven. We've had people come up, and I have people calling me, can I go and buy, what's the best immune booster to buy, and all of that. I think all you need is eat well, rest well, very well balanced diet, have a very good sleep.
But it's not bad to have some supplements, vitamin C, for example.
Yeah, no, it's not bad.
Okay.
Vitamin supplements are welcome.
Right.
But a very good diet and a good rest and a good sleep, because your immune system rewinds when you sleep.
Yeah.
So you need a good sleep.
Richard was asking about Kintampo. He says there's a research center there.
Yeah.
Can't it be improved? But
I think the Ghana Health Service Director General mentioned they are going to enhance it. He said 2 additional centers. The Medical Association has called that it should be regional.
Okay.
So that at least you can have testing across the country. I know there's a Kintampo Research Center, there's a research center at Navrongo. Their capacity may not be able to do these PCRs, but if we decentralize the PCR with mobile technology, they should be able to conduct some of the testing.
And Vincent asked a question which had been answered by the director of the Ghana Health Service already about what they are doing for the health workers. Thank you for that. But before we took the break, I was asking whether if we should have a ban or a shutdown like Mr. Kessie is suggesting, how could it be done? Should we do that in the first place?
Yeah, so I think a lockdown may be necessary, but if we are doing that, I would consider currently almost all our cases have come from the Greater Accra region and the Ashanti region. These are where we've had cases.
There was one in Temaizan also?
Yes, and it's still within Greater Accra. And so I think that we may want to consider, if we are doing a lockdown, these places which are the hotspots. In fact, we have called for what we call an infograph from the public health people to tell us where the hotspots are. These people who currently are treating themselves at home, where do they live? The people who have come out, where are they? So that even for the clinician, if a case comes to you, you can see closer to where we have cases reported.
So that there will be a partial lockdown, that's what you're saying?
I am thinking
of
a strategic lockdown. And we may begin by things like our transport system, where if you, for instance, say, trotros that move between from region to region, or buses that move in that, if once those are curtailed, there's some form of lockdown.
Okay.
If you lock down the central business districts, then mass movement of people will go down, because it's very difficult to say that people should not move. But there are some things once you do indirectly, there is some form of a lockdown. So if you say the central markets where people congregate should shut down, or they should not admit a certain number of people in a day, that's the form of a partial lockdown.
Elsewhere, where even the cities have turned into ghost cities, you see that some of the lockdown is not complete.
Yes.
You are allowed to go out for essentials.
Things. So that can happen. But for us, so if we had an efficient public transport system, you shut that down and you have achieved some level of lockdown. Without that public transport system, it comes down to our trotros and our taxis. If you impose a certain ban on number of passengers they can carry or where they can go to and restrict movement in the central business district, immediately we have a partial lockdown.
George, what do you say? There are questions being asked. Yes, he's the clinician, but I'd like to have your view on that as well. Questions being asked about whether if you use clothing, second-hand stuff that we all like to buy a lot, including plates. Should I visit my barber, for example? Women, should they go to the salon? I had to make a decision. I needed to trim up. I have my own, clippers and all of that, but I didn't go to my barber. Yes, so what do you say about those?
So this brings me to my initial statement I made when I came here, that we should not present this pandemic as the same as cholera or Ebola. This is not a hygienic problem. Hygiene helps to prevent the spread. But this virus is not a hygienic problem. So keeping personal hygiene would help. But the only solution, proven solution, is isolation. So you going to your barber, fine, you might keep all the hygienic instances, but what if he coughs on you? So it's not a problem of keeping hygiene is very important, it's very good. It helps slow down the transmission rate. But the real solution is keeping ourselves from intermingling with each other and spreading the disease. And I think that kind of messaging is what should go out, because that's what's needed now. The focus, hygiene is good, but the focus should be on social distance.
Yeah, I'll get Dr. Yes, what do you say about that?
I was just going to say that I support exactly what he's saying, but just to put out that the current data shows us that this virus can stay as an aerosol for 3 hours.
What does that mean, aerosol for 3 hours?
Like as droplets that come out of us when we sneeze and cough, it can be active in that space for about 3 hours. So that means that if you're in an air-conditioned enclosed place where there's no free ventilation, someone coughs and sneezes out and has virus in the droplets, it can last there for 3 hours. On copper, it can stay up to 4 hours. On cardboards, it's been shown that it can stay there for 24 hours. On a stainless steel, it can stay for 48 hours. And on plastics, it can go as much as 72 hours. So it means that on all these surfaces I've mentioned, droplets can land there, they can be contaminated, and they can stay there for a long time. So if you practice the hand hygiene of not touching, and when you touch, wash, then you are not likely to inoculate yourself. But when you enter a place and like your barber, as you mentioned, you may clean your hands, do everything, and as you mentioned, if your barber coughs or another client in there coughs, the person might even be observing the social distance with you. But if the person coughs, this aerosol can stay there for 3 hours. You are breathing in, you have no nose masks on. It means you can inhale them. So the best is for people who know that they have the infection, if they had a nose mask on, that would have kept all of us safe. Because when they cough, their aerosol stays within the mask. But until such that we are able to test and know all those people, the safest is if it is not essential, let's start imposing some sort of self-restriction on ourselves.
So if a woman needs to go to the salon, if they have a face mask, that's good enough so they can go. And as long as they can confirm that they are hairdresser or they are keeping to the practices?
Because we do not know who has and who does not have. If that going to the salon is not essential, suspended. That's what I would say. If you think it is so critical that if you got an infection, you don't mind, then your benefit outweigh the risk in this case, then you can go.
Okay. Yes, and George, again, the concerns have come up about the cost of sanitizers, vitamin C. They are running and people are increasing the prices. Veronica buckets was about 120 Ghana cedis. Now it's being bought for 450 and so on. What can be done about these things?
So I think this is where we have to suspend the notion of free market, and government has to step in. In fact, this challenge is such that it requires a social response. That means everybody is part of the problem or is part of the solution. no industry is left out. Government meeting with industry leaders should be one of support. For example, those pharmaceutical companies that can provide hand sanitizers, government should give them tax breaks. They should be able to produce hand sanitizers at minimum cost so that they can give it out to the public for free.
Okay.
These are the kind of support systems that government can do to prevent the social cost that was going to come.
Okay, so let's go back to the phone lines. I was putting together a number of questions that you have brought in by way of text messages, and they have responded to them as well. And talk about sanitizers. As we know, the FDA is doing quite a good job there. The FDA has tested and approved over 30 more sanitizers within 1 week. It is facilitating the process to ensure availability of sanitizers on the market, which will also help bring down the price. So this is also good. Yes, who do we have on the line? Let's take your question very brief. And if you want to share with us how you are coping whilst your children are not in school, as mothers more particularly, we would like to hear. And if you have a good way of ensuring homeschooling, that should all help others to take a cue. Yes, so we take more of your calls. And once again, talking about homeschooling, the Joy Learning channel is available. Wolo TV, together with Joy Multimedia, are bringing education right at your doorstep in your homes. All you need is a multi-TV digibox, and you can have your children, your wards, enjoy non-truncation of their learning. Yes, Michael. Michael, where are you calling from? Let's have you. Hello, Michael. Okay. Yes, Michael, I can hear you. Michael, you are calling from Kumasi. Let's hear you, quick.
Okay. I just want to find out about the internet. It seems it's very slow, and if things are going to be locked down, how do we communicate very well? Because we have to rely on the internet very more.
Okay. Thank you very much, Michael. George wants to say something about that?
Yes.
Okay.
So I was going to speak on our preparedness towards a lockdown. And as I keep saying, for me...
Okay, so let me finish with the questions. Yes. Frank, yes, Agozume, Frank. Okay, we lost Frank. Frank called from Agozume. You can call back. In the next few minutes, we can pick your call. So Michael was asking about internet.
Yes, it's part of what I think government should be doing now, planning towards supporting industry to help towards a lockdown. One of the key areas will be communication. I think the telcos should be made to bear what is coming and how they can support in terms of helping with communication. I think he also mentioned the area of transport. This is where government should sit down with transport leaders and see what they can also do to help curb transport.
We have an assurance that the transport minister is doing so. John is calling from Laura. John, let's hear you.
Yeah, good morning, my brother.
Morning.
Yes, I also want to use this opportunity to ask one question. You know, Laura is a border town to Burkina Faso. And all the time, we all hear about this coronavirus issues. Right now, it's very risky. What about the security men putting in measure to protect or defend this thing?
Okay.
Because our neighbors from the Burkina Faso, especially, there is a galamsey going on there. And the Ghanaian people are going there to sell every day. And they're also coming here every day.
Okay.
So what are the security men putting in measure to protect this thing? Thank you very much.
Thank you very much. I'm sure that the authorities have heard you. Yes, Kwesi from Dansoman. Kwesi is calling from Dansoman. Kwesi, let's hear you. Okay, I suppose we lost Kwesi on the line. And Dr. Bayo, John, who called from Laura, expressed concern that I think you have raised some of these matters already. Let me pick my very last call from Odum. You are calling from Bojuase. Yes, let's hear you.
Yes, what I want to say is that parents should keep their children at home. Hello?
Yes, go ahead.
Yeah, what I want to say is I'm a teacher, and I want the parents will keep their children at home. Don't allow them to regather elsewhere at playgrounds. That's another fertile ground for transmission. So parents should please keep your children at home, give them work to do, and doing things.
Okay.
So no matter what the work is, give them some work to quarantine them at home. Thank you.
All right. Thank you very much, Mr. Odum. And the latest on the global situation is 284,008 so far. The deaths have also increased. Yes, Dr. Bayo, what do you have to say to the last group of callers and what they have to share?
Yeah, so I think with regards to the gentleman who called from Laura, I think the risk is real. It's not only Laura, we have Hamley, we have all the border towns. And I think we should be coming up rapidly with a decision now, whether we are locking down our land borders as well, so that if it's a total close, we know that we are doing that. I saw a notice, I think, from the Togolese that suggests that they want to close their borders. I think as a nation, we should look at what we would do, and I hope that the directive will come out in that extent. I support the kids staying at home, and not only the kids. At this point, if you do not have anything essential doing in town, and to such a time that we have either a lockdown declared, you as an individual should assume that everybody else around you might be infected, and therefore stay at home if it's not essential to move out. Only essential workers and things, people who really have to go out, should be thinking of going out. I think that bit, I really support it.
Okay. It's an all hands on deck situation, and as you can see, there are even manufacturers of different other products which are now going into hand sanitizers to assist. I have cited that even Casapreco, for example, is going into hand sanitizers. All of these will help. What do you have to say, George?
Yes, and I really would call for the professional bodies to come together and start supporting government to find a way of curbing the problem from getting bigger. I think this is the time we all need to come together and use our professional expertise. This is a communal problem. Nobody is immune from this. So we should not be making demands at this time. We should be finding solutions. How do we innovate our services to take care of the challenges so that we can bring on board solutions that would help curb the transmission? Because we are all at risk.
Okay.
We are all at risk.
Yeah. Mayor Kofi says drones can also deliver the samples in record time, so we should be thinking about that. Already we are using the drones to do some work. Kobina Edu says, what happens with someone who shows symptoms in Navrongo? Okay, so you call the emergency lines. I'm sure they will direct you to a particular health facility.
And in fact, our health system is so decentralized. Right. At Navrongo, whichever district you find yourself, there's a disease control officer, and there'll be a local line you can call. But you can also call 112 and you'll be redirected. Okay. But there'll be a team that would come and help you have your sample taken. All right. And it can be transported.
Okay.
Something, one very quick last. So people are walking around from pharmacy to pharmacy, facility to facility with symptoms. I would advise that if you show symptoms, stay at home and call the hotline. You'll be told what to do instead of moving around, and because every time you move around, you are more or less potentially infecting.
All right. Anane Frimpong Kwabna says that good discussion. I'm an anesthetist, and I can say for a fact that we don't have ICU ventilators to put over 200 cases on in Ghana. How many ventilators has the Konfanochi Teaching Hospital, for example? As a health worker, that is part of my concern. Togbi Aklopi says that the emergency numbers don't seem to be working. Please don't call them unnecessarily. We understand that they really are working. Eja Adam says that the personal and environmental hygiene protocols are very important. Let's all take note of that. And thank you. We seem to have run out of time at this point. I'm Samson Ladi Ayenini. Thank you very much for your company. Always remember, wash your hands under running water with soap, at least for 30 seconds. You can use hand sanitizers as well. Most importantly, don't touch your face. If you have to sneeze, use a tissue. If you don't have one, do so under the corner of your arm. My guests who are here now have been Dr. Titus Bayo with the Ghana Medical Association, and also Mr. George Yeboah Kese with Crown Consults. Thank you all very much. Have a good afternoon.